morning, Porang Network. I've logged in with my iPad. I think it's not gonna give me problems again because I've been trying to log in until I called the lady. So what is the problem? So good morning, honorable members, all the commissioners here. Chair, are you here?
Good morning, Chairperson. Yes, I'm here, Chair. Thank you.
Okay. Good morning, commissioners. You are all welcome. And I am welcoming all honorable members, our staff members. It's hot here in Cape Town. And I think I'm gonna struggle with my network. But it's fine, we'll see. I declare this meeting officially open. Because we've got 3 reports that we are going to present. I think today we're going to finalize all 3 reports, Chairperson and CEO. I think what the CEO can do, can jump the mandates and introduction that you always do. And maybe in the first report, you can do the introduction, but try to summarize it. And then the mandate, maybe you can just highlight few
recording in progress.
Few important key points, and then we go straight to the report.
Recording stopped.
So that at least we can manage our time and finish exactly at 1 o'clock.
Recording in progress.
The meeting is starting at 2 o'clock. The budget speech is starting at 2 o'clock. So we must try our level best to push all 3 reports today because we won't be having another time. So this will be our last day to deal with all the reports. Without any waste of time, can I get apologies, Nelisa?
Good morning, Chairperson. Good morning, members, CGE and colleagues. I have received 4 apologies. One is from Honorable Peer, who's attending PC on Public Enterprise. The other one is from Honorable Hlongo, attending PC on Social Development. Honorable Hlengwa also she's attending PC on Health, and Honorable Pitt is not feeling well, Chair. Thank you.
Okay. It's fine. At least we know that of Vele, Wednesday, Piri and Hlongo, they've got portfolio committees. So it's only Honorable Mpiti that we were informed yesterday that he's not feeling well. Wish him a speedy recovery. But all other members are in most. And the portfolio committee on health, it sits every Wednesday. So their apologies are reasonable, enough to be accepted by the portfolio committee. We can move to the next item. Chairperson, apologies from your
Yes, Chairperson, thank you very much for the opportunity. Chair, I would like to tender an apology on behalf of the Deputy Chair, who will log on and off today because on media regarding the budget speech and the analysis, and we'll be looking at the gender side of it. So, Chair, I would like to tender that apology on her behalf.
All right. No, thank you very much, Chairperson. Let's continue, honorable members. Chair, you can start.
Thank you for the opportunity, Chairperson. This morning, Chair, we are presenting 3 reports very quickly. I'm not going to be long. The first one, Chair, is a report that we could not present last week, which is the investigation into the choice of termination of pregnancy in South Africa 2021 report, which is fairly a new report. And we did this work, Chair, as the Commission for Gender Equality, working closely with the National Department of Health. And we also worked with provincial departments in collecting the data that was really looking at the institutions that are providing termination of pregnancy services in South Africa. And the Chair, what we were interested in was to really look at the termination of pregnancy services that are offered. We looked at the issues of access and affordability. We looked at the issues of funding model or models thereof. We also looked at the issues of the basic package that these institutions or these facilities are offering in terms of counseling or psychosocial support, public education, referral system with other units or departments. For an example, if someone is found to be having elevated blood pressure, that person will be referred to a clinic that deals with that. We also looked at staffing issues, Chair, and training thereof. We also looked at complaints handling management by these institutions. So, Chair, I want to say that regarding that data, though, that information that was collected, we were then able to put together findings, and we were able to put together recommendations that will be presented here today. Other reports, Chair, that we are finalizing today is the ERAP report, as well as the CEDAW report. So without waste of time, Chair, I will hand over to CEO to start presenting the TOP in South Africa report. Thank you, Chair.
Thank you very much, Chairperson. CEO, good morning, and over to you.
Thank you, Honorable Chairperson, and good morning to Honorable Chairperson and Honorable members. I am projecting the presentation. May I check if the presentation is projecting?
Yes, it is.
Thank you, ma'am. I'll just put it on. Again, morning, Honorable Chair, Honorable members, and my commissioners and colleagues. As Chair has indicated, this is one of our latest reports. And Honorable Chair, I will do as advised in terms of our mandate, which is introductory information that we present to the Portfolio Committee as a preliminary introductory section for our reports, also including the legal framework, which lists the frameworks that we are operationalizing as we do this work as the CGE, including all the ones that I'm projecting, your Beijing platform, the SADC protocols, the Constitution and its sections, as well as now the Choice on Termination of Pregnancy Act. And this is where I will try and give a brief background, because this is the relevant act for this study, where we were monitoring implementation as introduced by the chair. And I think in this slide, suffice to indicate that, as we know, this act, like many of our laws in South Africa, are deemed some of the most progressive laws in the world. Actually, we do claim. Yes, there is noise coming in, Honorable Chair. I will just continue as best as I can. The Act was enacted in 1996 and amended in 2008 to specifically to increase facilities that provide terminations and also include the rights-based framework for addressing women's sexual and reproductive health and rights, which is a key component, we argue, in realizing gender equality. And again, as with every presentation that we make at the CGE, we do point out that despite having this progressive legislative environment, the implementation is still a challenge that we still need to work on. Because access, systemic barriers still exist within, in terms of access to termination services in the country. Though the Act has been in existence for 24 years, which is pretty much as long as our democracy has existed. So perhaps this is the time where we usually say we really now need to focus on implementation, because what we want to see coming out is women's rights being recognized, especially women's reproductive and sexual rights. The Act provides that terminations can happen until 12 weeks of gestation and up to 20 weeks in cases where you have situations that of hardship, such as rape, incest, and for reasons related to the woman carrying the pregnancy and the fetus. So there are certain conditions that would warrant going beyond the 12 weeks. And we also need to recognize, as I would normally say, the positive side of progress that we have made, because this Act was enacted specifically when you look historically. Many women were dying in what we used to call back then backstreet abortions. And since the Act was enacted, this was introduced by over 90%, which is a very good sign that having this service available to women is a good thing in terms of reducing maternal mortality. But as we will see as the presentation goes, obviously there are certain areas of improvements that we need to now focus on. And perhaps also to mention that since the introduction of medical and surgical abortions being provided free at subsidized codes, the accredited facilities were designated by the Department of Health, and also private facilities that are accredited also provide these services. I have pretty much mentioned that despite the positive trajectory in terms of legislation, we still have those bottlenecks in terms of implementation, in terms of reducing systemic barriers that we still need to focus on. Especially as it pertains, as usual, I will usually say the previously disadvantaged people are still currently disadvantaged, because in pretty much every presentation we make as the CGE, when it comes to barriers to access, those who are mostly affected are poor Black women in rural areas. And this is the picture of apartheid that I usually would refer to in different presentations. In terms of the methodology, this study was conducted during the time when we had more stricter levels of COVID protocols. So we relied on dispatching questionnaires to the Department of Health, national department, and also provincial departments, seeking information specifically on the institutions that are providing termination services, issues of access, the funding model, the referral system, and then we assessed the information that was provided, including the assessment of how they promote access to TOP services, promote in a sense of raising awareness around the availability and accessibility of services, so that women who are in that situation don't find themselves going back to the hanger methods, as again back in my day we used to refer to these issues. Also issues of public educations where were in the questionnaire, issues of disaggregated data, and also how recruitment of staff who would be involved in providing this service was done, and also the complaints management system. The limitation, Honorable Chair and Honorable Members, is actually repeating what I said in terms of the limitation posed by the COVID condition in terms of physically gathering data from our participants. Therefore, we relied on the questionnaires. Honorable Chair,
we didn't hear you. You were cutting. Maybe if you can go back a little bit.
Oh, I was cutting, Honorable Chair. Okay, I'm not sure. I was talking to limitations. Was I audible there?
Yeah, when you were talking about limitations, you were audible. And okay, where you were talking about recruitment of staff.
Oh, okay. I was talking to the methodology.
Yes.
In terms of the information that we gathered. So, yes, one of the questions we asked was how staff who provide the TOP services were recruited. So it's one of the lists that I have mentioned. Maybe Honorable Chair and Honorable Members, if I can say, we ask questions around the number of institutions or facilities providing the service, the issues of access to the services, the funding model, the referral system, the assessment of information that we received, including the promotion of TOP services in the context of raising awareness on the accessibility and availability of the services, including public education on the services, disaggregated data were requested in terms of the services, recruitment of staff, and then the complaints management system. And then the next slide is where I was talking about the limitation, where I was saying, as indicated earlier, the COVID situation meant that we relied on sending questionnaires to the participants, analyze the questionnaires, and then where information was not clear in the questionnaires, our legal officers will obviously follow with a telephone interview to try and get information to be clarified. Excuse me. And I am now going into the findings. And I wanted to indicate here, Honorable Chair and Honorable Members, that we start with the Department of Health. And I want to be a little more detailed here, because the findings, as you would imagine, the mother department, as we go provincially, you see commonalities, you are able to verify information, what is the experience at provincial level as compared to the responses we got from the national department. So I will go through this in a bit more detail so that I can summarize as I continue to provinces, especially because even the provinces, there are differences and commonalities in the findings that we will present. So in terms of the national department, they reported that there are 350 facilities that provide the termination services countrywide. And it was also indicated that medical abortion was introduced, which was not part of the Act as amended. That facilities provide medical abortion. So this is before 9 weeks. If remember, initially we talked about the Act specifying 12 weeks and then 20 weeks under certain circumstances. And then we also wanted to find out whether, which facilities are fully equipped in terms of from the department's perspective, and then and this has to do in terms of the equipment, including both human and material resources to provide the services. And the department informed us that they are procuring through donation equipment to 285 of the 350 facilities throughout the countries. And when we analyze the data that we received, and this I think I need to be emphatic that because when we do research, at the time of analysis and finalizing, we depend on the information we have. And when there is more information that we didn't have, we need to acknowledge that this is based on the information that we have, that we only saw Zola Clinic with a signage that indicated TOP services. Madam Chair, I will be making those little pauses as I sip water. So in terms of access, the Act provides that in terms of Section 2, that it provides that pregnant persons can terminate their pregnancy within 12 weeks as indicated. The department submitted that the last week of first trimester is 12 weeks, which was confirming that they are implementing as per the Act. The Act also fell in terms of allowing to 20 weeks. We were informed that women who are 12 weeks and above are referred to the relevant facilities, because some facilities are equipped to terminate up to 12 weeks. Others are those that can then handle those unique situations, like I said, issues like incest, rape, and other difficulties that the woman might be facing during this need of the service. The department also indicated that the facilities display the list of services offered. If a top service is not offered in a particular facility, it will not be included in the list. Therefore, the issue of Zola, as our findings indicated, was used as an example to say that's why, because that's why they have the signage, because they provide the services. We were also informed that the department, it acknowledged the unwillingness of health practitioners to perform top services, and this is one of the I would say the biggest barriers to service delivery, because in my experience decades back, when we were training service providers, health service providers on the CEDAW Act, that was one of the major issues where the issue of value clarification was one of the strongest recommendation, because it's when it comes to issues of your conscience, it becomes difficult because we perceive this differently. But the emphasis is this act was not enacted to say terminations, but must replace prevention or contraception. But it recognized a problem that the country had already identified, that women were dying unnecessarily because the service was not provided freely in legitimate facilities. So in terms of the questions asked during the interviews, the department indicated that no standard questions were developed per se, for appointing as providers. This depends on the job. Maybe to make a quick example, if a person apply for a job in the Department of Health, which is finance related, for instance, the interview guide wouldn't include questions around COP. But if a person is applying for a job as a head of the department that provides reproductive health services, then those questions will be asked. Or if a person is applying for a nursing post, for instance, then those questions will be asked, which to a certain extent, it's understandable, because if for these issues, they are cross-cutting. A finance person should be able to understand these issues, to be able to understand budget motivations for the service. So that's another debate for another day.
It's only on my side.
Honorable Chair?
Is it on my side or is from your side? Because I was hearing nothing.
I'm not sure, Honorable Chair. I want my volume is 100% unless the network.
CO.
Yes, Honorable Chair.
Chair, we can hear. I've heard it.
We are hearing it.
Oh, you heard it?
Yes, Chair. I think it's your connection.
Oh, okay. That means. All right.
Can I continue, Chair?
Yes, CO.
Yes. Honorable Chair will nudge me if I cut on your side, so I can repeat maybe where Honorable Chair has missed important information. I'm still on the national findings on the National Department of Health now in terms of the funding model. And the department informed us that they use the equitable shares model. And I'm sure we are familiar with the equitable shares, but I think for us, we also want to see the details of how the allocations are made. But unfortunately, at the stage of the study, we couldn't get that information to see how the equitable shares model is used to allocate funds to different facilities. That information may exist, it might not have been available during the study, so that's what we are reporting. The department also submitted that they assisted provinces with procurement.
So yes, you didn't see that one, the equitable share that is allocated for top.
No, we were informed through the questionnaire, but when we followed up to get the actual information that we could analyze to see how the equitable share model is utilized. So remember, one of the issues that we keep presenting is that you find unequal allocations of funds to different facilities, with the key problem being the previously disadvantaged continuing to be previously disadvantaged. And hence, when we ask these kinds of questions, we also want to see the actual allocations, but this is the information we couldn't get during the study. That's why I'm insisting that the information may be there, but during the study, we couldn't acquire this information. And as it was presented earlier, the department indicated that they procure equipment for facilities. Previously, in the previous slides, it indicated that through donations to about 285 of the facilities out of the 350. So for us, it will be important to ascertain the exact funding model used. We know about the equitable share model, but to see the exact details of how provinces are allocated these funds. And these are some of the issues that will help us improve in terms of equitable allocation, as well as facilitating access to these services, especially for those provinces that continue to be disadvantaged. In terms of the referral system, we found that the referral pathways was clearly indicated to facilities. So in terms of the service, to minimize unnecessary traveling to and from various facilities, the department provides referral letters, and this we in other research, this I have witnessed, but you can't say it applies overall. But the department here have done what needed to be done in terms of providing guidelines when it comes to referrals. But to test the effectiveness of the system, reference can be made to the complaint received by the CGE. So the good thing is that as the commission, as we do all these investigations and research, at the same time we receive individual complaints, and we had a complaint using, applying the issue of the referral letter. You had a complaint where a woman came to the CGE and said, I was turned away from the Shawelo clinic because they said they're dealing with emergencies. And we wrote to the Director General for intervention, and the complainant was assisted. So when you look at this, and we hasten to see, this might be a tip of the iceberg, and experiences, yes, this is the tip of the iceberg, because these individual cases sometimes escalate to show a national situation that we are finding at high level as we conduct these interventions. So the systems, it says to us, Honorable Chair and members, the policy environment, guidelines, and other things may be there, but implementation is a different thing, depending where you go, who you need to be assisted by, and how they perceive the service. So this is a common thread throughout, even when we go to provinces. That's why I'm giving detail here.
Okay. CEO,
yes, ma'am.
Did you ask questions like, for instance, I know for the fact that sometimes in some institutions, when a client comes in, wants to do a top, they ask you, how many times have you done it? So I just want to check with you, Uti, whether you did ask some of those questions.
Honorable Chair, at this stage, can I note the question so that I can look at the questionnaire itself? Because in the presentation, it's just the headings of the questions that were asked. Yeah, so I've made a note, and I have come across that question in other research in another life, where that was because women were accused of using terminations as contraception.
Mm.
So that's why some service providers would ask that question. But in the context of this presentation, I would have to ask colleagues to check the questionnaire if that specific question was asked.
Okay.
Thanks, Honorable Chair. When we assessed the information still on the National Department, the information we couldn't, it wasn't conclusive, but rather follow a general approach. If you look at, like I said, at a high level, some guidelines and so forth, the general approach is there, but if you look at issues of backlogs, as you see in the provinces, you begin to see that the experiences at different levels are different. And also using the example that I just made of a woman who was turned away, the CGE intervened and then she was assisted. So it's those kind of situations for me where we really need to put a finger on where the problem is. and in terms of implementation, focus on that. The department also submitted that it was not aware of any current backlogs, but the data, as I said, can be verified as we go provincially, because the prioritization in that situation becomes different, as I have mentioned. In terms of the promotion of the services, it was indicated that training is conducted for staff members who provide the service, and that, for me, it's not a first finding. You usually see it in different research projects, and I'm mentioning this, Honorable Chair, because there are some presentations that we make with new data, and that one can ask, is this data valid? And for me, some of the previous research where we still find the same finding, it validates the data. So the training of TOP service providers it generally happens, but the quality thereof and how many, how often, it's another discussion. But the department does have a training manual where they indicated module 3 is about the provision of termination of pregnancies. And in terms of public education, one of the situations that was cited was consultation across the media fraternity, and this apparently was publicized, and it was in media, print and electronic media. But now the question would be how often this happens, because for me, this is one of the best strategies, the media route, because you reach a wide audience in terms of information around availability and access to services in different sectors. In terms of disaggregated data, Honorable Chair, again, I will indicate that this has been a problem across sectors. When it comes to disaggregated information, you don't really get that in many different things, and in this service as well. But as we go down to provinces, we will see how this is provided in different modes. And standardization in terms of providing disaggregated data is very important, so that we are able to see who access the service, where, how, when, and so forth. And when that is not there and we don't have a standard, we will keep comparing apples to bananas and not be able to make decisions. Disaggregated data needs to serve to inform decision making for policymakers, lawmakers, and everyone who is using this information to improving access to services. In terms of the recruitment of services, as indicated earlier, the interview guides vary depending on whether the appointed, the person being appointed is going to be involved in the service or not. I hope I'm still audible. I'm hearing other sounds, Honorable Chair. Your protection, please. Thank you. In terms of complaint management, as per the information received from the department, they highlighted that each facility has a complaint and compliments box, or what we call the suggestion box, to register complaints or compliments. And this sometimes we see in facilities. And again, it's how we respond to those that is being an issue. How do we respond to those complaints? And it was also indicated that the department have complaints submitted through what is called the Mom Connect system, which is apparently an online system where you can submit complaints to the department. And we, as the CGE says, it would have been important if we would have had data submitted on complaints received and resolved. And this is what I was talking about, that you may have a box and how the box is used, how are the responses handled, and so forth, is where now we need to pay attention to. And this, Honorable Chair and members, one is emphasizing because one is pushing from policy to implementation, if you like, which is we do have the systems, we do have the policies, but how are we implementing? So resolving complaints is one of the situations. People don't have to come to the CGE to say I was refused a service. And the CGE has to intervene. That system needs to be addressed at service delivery level. If we were to say implementation is happening. The department did, however, report that 7 cases were received regarding the failure of health workers to adhere to Batubili principles, and this would have been in the best interest of the department to supply the CGE with this information. And again, I'm not sure if we can say, because of the conditions in the country in terms of the pandemic, certain things that would have been easy to access were not easy to access because there were different factors affecting how we access this information. So again, I want this presentation to be seen in that context. But with this information being taken into account that this was the situation when we conducted the study. I'm going to go into provinces and try to run through it quickly, where things are different perhaps from what we gathered from the national department.
So CEO, if I heard you correct, this was a qualitative research.
Yes, ma'am. It was qualitative, but quantitative in a sense that we also asked questions that involves how many facilities. Disaggregated data gives us quantitative information as well. So it was both methodologies conducted through the questionnaire and the telephone interviews.
Okay.
Now starting with the Western Cape, in terms of facilities that provide the termination services and are deemed to be resourced. There were a total of 109 fully equipped designated facilities, 92 actively providing the service, some healthcare service facilities served by roving teams, while others served by permanent staff as a roving team. So these are like your different ways of doing it, which differs in different provinces. The department in the Western Cape also indicated that 92 sites provide comprehensive reproductive health services, and termination is one of those. And I think this is what one of the situations where the country had gone into a drive to promote comprehensive services. So a woman doesn't go into 10 clinics to seek services for different reproductive health services. So this is one of the positives in this study to observe. Additional 17 sites available should capacity increase. So in the Western Cape, in a nutshell, you had a situation where there were plan Bs, so to speak. Should there be a capacity overload, they were able to refer services to other facilities that are not, let me say, overly burdened, so to speak, in terms of the need for services and the available resources. The department also indicated that it was difficult to assess whether the functioning of facilities are sufficient to save the communities where they are located. And this speaks to, like your remote areas. So I think that specific study, because we find this when we do these investigations, but for me, it's almost like we really need to put a finger on which remote areas are underprivileged and therefore not receiving the services as in a desired manner, so to speak. And Honorable Chair, if you may allow me to skip this slide, as it emphasizes some of the things that I mentioned when I was presenting on the national department. And the issues of budget, again, there was no specific budget allocated to services. And again, this is a common finding for other different services. So you have a ballpark budget. You don't say for CEDAW, based on history, what do we normally get per annum? What can we allocate for that, depending on what services cost? You don't have that specific evidence-based allocation of resources, but you will have a ballpark that says this is a budget for reproductive health services, and then every service will find its way in there. And that is not ideal because it doesn't help us improve where there are weaknesses. Hence, the issue of disaggregated data comes in here to indicate how we equitably distribute our resources. In terms of the referral systems, the department also have accredited sites. The issues of referral pathways and referral letters were also indicated. And again, I'm sorry, I'll keep like sounding like a broken record, because again, it speaks to systems being there, but operationalizing this system, which is what ultimately saves a woman's life, is what now we need to focus on. Although in terms of this report, the Western Cape can be said to be one of those provinces that at least do have quite some services in place, and this relative to other provinces that we have conducted research on. In terms of the assessment, obviously, if I can call the women clients, that they are assessed before a termination is confirmed, including confirming if the pregnancy is there. And we know conditions under these circumstances, the counseling, taking the history of the client, other observations, including physical examinations, and consent as well. Consent, which is very key if you look at other research projects that we have in the CGE, that where the issues of consent have become a big issue. So this is in terms of how clients are treated. In terms of promoting the service itself, they were informed that the service are advertised through questionnaires, of course, and interviews. They are advertised in accredited facilities. In terms of the department, we mentioned that the information submitted only showed Zola Clinic, but here we were informed that there were posters displayed in facilities. And unfortunately, under normal circumstances, you want to go and see that indeed they are there, but when the study was conducted, as indicated, that was not possible. This slide also elaborates on that, but the key is that community health facilities, health workers, so the promotion was there, and I don't want to use experience from other research in this regard and confirm, but I will present what is in the report at this stage. Public educations, issues of radio talks, local newspapers, sessions in facilities. In terms of disaggregated data, the first trimester up to 9 weeks, we have this information. So it was shown how many were done up to 9 weeks, how many were done up to 12 weeks, and so forth and so forth. And the numbers are indicated in the paragraph below in terms of detail, but just to highlight that some of that disaggregated data were provided. And this also included from public and private facilities. So this slide, honorable members, is just summarizing, as I was saying, what I've presented in terms of the district or the metro, the number of public facilities that provide CEDAW, and the total that was rendered by each metro or district in 2019-20. And as we can see, the highest there being Cape Town Metropole, and then the lowest being 0 at the Central Karoo district. The Western Cape, I want to see if what is here is already presented. Perhaps to say that it was reported that the TOP, as presented previously were performed successfully, and under rare circumstances, an incomplete procedure to the clients is referred to a special center. There is currently no backlog in the province reported. And the department also indicated that the challenges they have, they ensure that it is they put an effort to train more than one provider per facility to correct the misinformation in relation to the reliance on ultrasound. And these are technical issues that they are trying to address. As we indicated, they do interview the test or examine the client if there is a pregnancy or not. The recruitment of staff, they reported that the recruitment process, again, is an issue of relevance to the top provider as reported by the department. So the interviews or the recruitment process will look at what the person appointed is going to do. And for those who are specifically going to provide the service, this is now the issues of your value clarifications are included in the interview guides, what they call a conscientious objection, as I had indicated earlier. The HR policy also do indicate issues relating to the issues of value clarification around these issues and other issues, because this is not the only service that have issues of personal beliefs involved in. But the objections, as I indicated, existed 20 years ago and they still exist. And it's a matter of continuing to understand the objectives of the Act, what it tends to do to try and remove these barriers to services in as far as TOP is concerned, as elaborated in this slide. So this is just an example of the complaint management or the complaint box, as was indicated earlier in terms of how complaints are managed. This slide, Honorable Chair and Honorable Members, also elaborate on the issue of complaints management, which as indicated, the department has alluded to that in a broader sense, and the Western Cape in this sense confirms that, and their complaint system includes calls to the contact center. So this is why I said the Western Cape seems to have a more elaborate system and implementation thereof in terms of the questions that we have asked. So this is a list of some of the methods that are used to handle complaints. But then again, that question for me remains in terms of, if you like, we can say backlogs in terms of how the complaints are resolved. In terms of the data that I was referring to in terms of numbers, they did indicate those complaints that were received, and majority were resolved, as we can see there, and a few, 110, I say a few compared to 600, were still outstanding. So they basically are resolving the majority, as indicated there, 82%, so to speak. And some of the complaints are sent to the HOD. So basically it depends what the complaint is about. If it's about a nurse, for instance, it will go to a particular point. If it's about a barrier that has nothing to do with the nurse, for instance, it will go through a different route. As I have said, just to elaborate that, the modes of referral for complaints vary. I don't want to repeat that because it's elaborating on what I have summarized. The Free State recorded that, let me just say perhaps that the information was brief when we analyzed what we had received. So they reported that they had 12 fully equipped facilities in the province. And for us, given the size of the province, the Free State, we didn't feel that the 12 facilities were sufficient to serve the province, and they also indicated that they have 23 qualified staff members within the province. And again, it's the same comment that given the size of the province, 12 facilities and 23 service providers don't sound like the province is well resourced. They also provided a criteria they use to determine whether a facility is adequate and is adequately equipped to provide services, including the availability of trained medical staff, operating theater, appropriate surgical equipments. And Honorable Chair and Honorable Members, given what I have just said, this assessment of whether the facilities are well equipped, it's a good practice, but we already know that the province is not well equipped in terms of resources, both material and human resources. In terms of the funding model, the department indicated that they make use of voted funds, and I think that still speaks to that equitable allocation of resources that I presented earlier. And obviously, the funds are allocated and ultimately used to clear in the response of the department and can therefore be analyzed. This speaks to what I said in terms of the detailed allocation that we talked to previously. In terms of the referral system, they refer clients that require the service to designated hospitals. They have SOPs in place for referral. And again, these are some of the issues that through you, Chair, I may skip because they confirm what the department has reported. And also in terms of the Act, where the issues of gestation in terms of termination are presented, and the procedure in terms of the procedure that they follow before referring a top clients include your consultations with a primary health care giver, predetermining. Again, I will not repeat this because they are similar to what I have presented in terms of initial examinations before they provide a service that is required, which is termination. In terms of promoting the services in awareness, raising availability, accessibility, and so forth, the Free State also indicated they advertise the services. However, it was not indicated how this advertising and where, for example. And again, where we say information was not conclusive or not available, that means even on telephone follow-ups, that information could not be determined for different reasons. The call may be taken by someone who don't have the information, and I'm just giving loose examples in terms of different factors that affect whether we access information as we do this work. Public education, radio talks, again, public sessions, posters that were provided in hospitals, disaggregated data. As we can see below, the information that we got around the terminations within financial years. So again, as we can see, the information says in this year we did so many, but we don't know who that is. Gender, race, all those kinds of demographics that would help us make decisions in terms of resource allocation. The recruitment of staff, and again, here you have situations of unwillingness, the issues of value clarifications, but the effort to conscientize people is part of the recruitment process if those people are going to be providing the service directly. One of the things that we comment on as the CGE is that the department should conduct a culture survey, and we provided a timeline in this regard with a view to establishing work satisfaction, sexual harassment, and so forth. And these are like your internal facility or institutional situations that would be mentioned as we conduct this work, that we're working under these circumstances, which contribute to all other challenges that may be experienced, ultimately impacting on the clients themselves as these services is provided. In terms of procurement, the department should consult with the Department of Trade and Industry, National Treasury, and the Department of Small Businesses that has a mandate on transversal information technology bids to include people from rural areas, LGBTI, and persons with disabilities. Honorable Chair and honorable members, you will know that again, in pretty much every presentation we make, these are the issues that keep coming up. And as the Commission, we keep saying, these are the areas that we also need to pay attention to because they cut across. It doesn't matter what sector you go to. Last time we were presenting on the transformation, the public and private sector, it was the same issues. So the issues of skill transfers were also indicated to the department. The information that we received suggests that the training sessions deal with the following aspects. And Honorable Chair, maybe I will just mention a few there, including the issues of the reproductive health, the female reproductive system. So just the teaching people about the anatomy of a woman and how everything happens naturally or in many other ways, issues of value clarifications, as we have said, the interactions of client service providers, especially through videos, and the list goes on, including your gender-based violence and clinical practical sessions. So these are some of the training sessions, information that is provided in the training sessions. The complaints management, the department indicated that about principal posters as well as complaints procedure posters are on the walls. And I will repeat myself to say it's one thing to have these things, but are they serving the purpose they are there for? And that depends on us as human beings who are providing the service. Turnaround time for handling complaints, it was said to be 72 hours. However, to date, the questionnaire, no complaints, to the date of the questionnaire, no complaint was received about health workers failing to adhere to Batubili principle on top, including issues of top services. If I can perhaps skip the slide as it elaborates and come to the Northwest institution that provide the service, 26 facilities, similar to the Free State. And again, I note the location of the provinces and their history. The issue is that you will find the outer parts of South Africa, previously a disadvantaged area, the less the services, access to services and availability to services you find. So this is basically pretty much the repeat of what I have indicated. And the funding model, as I indicated, is that ballpark that is allocated to a bigger program. And the equitable share formula is the formula that is used by National Treasury. Again, it's the same situation that I have presented. The referral system, they indicated that they have a referral system for areas where the service cannot be provided. So if a rural community, for instance, doesn't have a clinic without that community, they refer them to the nearest centers. In terms of assessment, here it's where you see differences in terms of the information we have between provinces and perhaps what the department has in the guidelines. So the Western Cape had a whole long list of how they assess pregnancies, from determining if the pregnancy exists all the way to other physical and psychological examinations. But in some provinces, you find that they do what they can with what they have. So they may not do a comprehensive examination as other provinces may have. The counseling by psychologists, this is one of the common findings across the provinces, although it's not common in that many of them would have a psychologist where they refer clients, or the psychologist is based in the facility and so forth. So you have those variations. The information was also requested whether there is a standard from that must be completed by people accessing the terminations, and whether this form does not deem counseling as a prerequisite before termination can be done. And this speaks to what examinations they do before they terminate. And here is the difference, which is why the investigator here went further to say, do you have a standard that says you can't cancel, counseling is not part of the process. So or how long the process takes from first consultation to actual termination, whether the consent form are written in all official languages so that people are fully conversant with the terms of the procedure and the consequences thereof. So these are some of the extra questions we ask when we find that a facility is not addressing the service as prescribed by the Act and also by the guidelines of the department. And the information was requested, the information that the questions that I have just asked, and follow-up was made. And unfortunately, at the time of concluding this report, we did not have these questions answered by the Northwest. And for me, this again is where I say in some of these, not some, maybe all or some were relevant. There are things that we still need to pick out, our recommendations, our questions, and follow up and say what happened to this situation. In terms of the promotion of the service, it was submitted that TOP is included as a service that in most facilities during the health education sessions and dialogues, it's part of the topic that covers safe terminations. In terms of the methods currently available for first and second trimester, they have medical terminations that are done to those who are still below 9 weeks, and this they following the guidelines as provided before. What you do at 9 weeks, medical abortion, surgical at what gestation, and so forth. So that is what they're providing. The issues of recruitment, it's a common situation, as had been indicated earlier, that questions are directed to those who are involved in this service at different levels. But again, the issue of unwillingness continue to be a systemic barrier. One is curious as one speaks whether a person will decline a job because they don't want, they've been asked if they are willing to provide a service, but that is not a question for this presentation. In the Northwest, measure put in place to ensure that service continue considering the unwillingness of health workers. Again, your conscientious objections, the issues of value clarification training, and in terms of if this includes in the list of questions during top interviews by practitioners, we asked, and then if yes, attach a sample. Again, the advice that where applicable, questions are asked. And with your permission, Honorable Chair, I may skip this slide because it's a common finding that I have already presented to try and expedite. The public education on TOP services in the Northwest, we asked if the department has proactive measures to educate the public, and they advise that there are continuous community awareness campaigns to educate the community. And maybe I can even add that even the commission itself, in its public education sessions, these topics are part of the material. In terms of this disaggregated data, as we can see there, 39 providers within the province, and the breakdown is as follows: that you have 20 in Bujanala, and 9 in Ngakamudiri, and 4 in the Dr. Roof Khomotsi Mumbati district. So this is where I was talking about how disaggregated data is given in different way. And as a nation, we need to say what it is we want to know around these services, and then say, define what we want in disaggregated data so that we are able to make decisions that will impact on how we allocate resources. Just a short brief, again, differently presented in terms of statistics. Here we have the name of the facility, although it only indicates the province as submitted to us, the data that is provided in terms of the gestations, and then also the financial year and the total number of terminations that were presented. The information helps to a certain extent, but for me, it needs to provide more disaggregation to help authorities in the province and in the country at large to say where do we need to intervene. In terms of factors contributing to some clients not getting the service, some of those include issues of gestation, for instance. We know what the Act says. We know what the Act says, under what circumstances you can go to 20 weeks and so forth. So these things, you can imagine the dilemma of a service provider when I come and I am perhaps almost near a conclusion of the pregnancy, and what do they do? So these are some of the challenges that service providers may face, because obviously they can't make decisions on the desk and say, I hear your reasons are good, therefore we terminate, only to find themselves that they have contravened the law should anything wrong happen in that situation. So these are some of the unique situations that add to the list of your subjective beliefs and so forth. And again, the criteria used to select people for top on the waiting list, they indicated that the last week of the first or second trimester are identified as priority. And here they are using the standard guidelines. In terms of complaint management, they stated that each facility reception has a flow chart indicating the complaint system and channels of reporting. So TOP is not singled out, but is included as one of the services, the sexual and reproductive health services. And I suppose this is a discussion for perhaps another platform, but it speaks to that situation where you have systems in place, but how accessible is this for an ordinary woman who can read a poster and understand, oh, so this is what I must do. But those are different questions there. The turnaround time for complaints was said to be dependent on the nature of the complaint, but however, the complaint should be resolved within 25 working days. So you have those vast differences where in some provinces it's 72 hours and in some it's 25 days, just to highlight the need of standardization in terms of guidelines that direct all the facilities in terms of how to do things, because obviously the facilities, they have their own mode, they have their own reasons, but where do we stand as duty bearers in this area in terms of how things are happening? And are these things helping the people who must receive the service? The Gauteng, 26 fully equipped hospitals, 34 community health centers that are responsible for the service. in responding to the sufficiency of the hospital, the department said yes, there are the facilities are well equipped and cater for the needs of the people. The department emphasized that they were guided by the Act in the services that they provide. The funding model, again, is the issue of the equitable share approach, and the questions remain that were asked earlier. The primary health care approach is taken in Gauteng, and again determining the service around the issues of trimesters, and the detail there, Honorable Chair and Honorable Members, just shows how the assessment of patients is done, and it is similar, I would say, to what what the list in the Western Cape provided, with very slight differences. But of key is that the Gauteng also seems to have enough capacity to follow the national guidelines. Promotion, again, it's you have the advertising, you have the public education. So these are some of the common areas, the issues of posters, community radios, and so forth. The barriers, the introduction of the medical termination of pregnancy procedure for health practitioners, new things being introduced. Again, you have those kind of situations where a paradigm shift must happen before a service is provided the way it is intended to be provided. Other things, again, include issues of value clarification, disaggregation of data. We received information that there is 94 staff members who are equipped to perform the service. In 2018-19, the 20.7 thousand cases were conducted. Again, here you have annual statistic, and the previous comment I made about statistics that helps us make decisions are required. In terms of barriers, again, the issues of doctors or service providers' unwillingness to perform the procedure, especially for women who have gone beyond the 12 weeks and above, what circumstances have health workers object to 16 weeks. I suppose maybe that detail needs to be understood, because if a woman have reasons that justifies the 20 weeks, that need to be clear. And in an investigation, the questions that were asked provided this, and I'm just adding few questions that need to be explored further. The high demand for services and in Gauteng create backlogs. That was one of the indications. Complaints. Yes, ma'am.
You've taken more than an hour in this presentation, and
Yeah.
you need to finish all the reports so that as members must engage in
Yes.
documents. So if you can try and wrap up, is how they will. Sorry.
Thanks, Honorable Chair. If I may request guidance, because the rest of the provinces, actually, if I were to say this in 1 minute, I would say that the information I've already presented applies across, with slight variations, as has been indicated, between the Western Cape and the third province that I have presented. So if Honorable Chair allows, I could scroll down to the recommendations, because the presentation is very long.
That's highlight key issues.
Okay.
You are presenting Gauteng now, highlight issues, especially where there are common issues across provinces.
Okay.
Yeah.
Thanks, Honorable Chair. The complaints management system, I'm just looking at the issues of the mode, and maybe unique here, it's also a call center. The duration of the complaints, that's what I wanted to highlight. If there is a difference, 25 working days is indicated. Skipping to the Western Cape, what is unique here, 31 district hospitals and 65 conducts deliveries. And 9 community health centers out of 28 conduct deliveries as well. And one would, I think in reading this report, one picked up that where they conduct deliveries, they also conduct terminations. The funding model is the same story. And the referral is where you also get common findings that 20 weeks they are referred to where the service is provided. The assessment, again, is there are common findings in terms of assessing before you conduct the service. Promotion, they're talking about advertisement as well, although the detail is not there. Disaggregation of data provides the gestation as well. These are the commonalities I'm pointing out. The barriers, again, it's issues of the common thread across the issue of unwillingness, and the disaggregated data, as we can see, is how it was provided. I think it was the Free State annual totals. The education, again, awareness campaign is the similar. The complaints handling, they have monthly reporting casing on the online, so it's like they have an online system, and again 25 days seems to be common across some provinces, and I think it's only one where I reported a 72-hour turnaround time. The Northern Cape fully equipped facilities are listed there. And the detail there in terms of which provides the services and which do referrals and taking into consideration, of course, accessibility in terms of traveling for the clients, because usually you find, and this doesn't imply that only poor women conduct TOP, but in remote areas, you find that the majority of people who find themselves in these situations tend not to have the resources to access the service, including transport. The funding model, again, it wasn't clear, but that issue of equitable share, you couldn't tell how the funds are allocated. The referral system, you have commonalities and slight differences here. The assessment.
At CEO, in other words, they don't know how do they fund it.
The Honorable Chair, it's that situation where you will be told we have a budget for maternal health, or we will receive a budget through the equitable funding allocation mode, but you don't get a document that says this is how much we get for termination services, this is how much we get for cervical cancer screening services, and so forth and so forth. So that is where we say it's not clear, and that needs to be clear so that we are targeted. We need evidence to inform how we allocate the budget. That's what we're talking about, and this is common across in this study, ma'am.
Okay.
The referral system, again, you have that referring to another facility if the facility is not either not providing the service, or the trimester is beyond what they can do in terms of providing the service. The assessment here, they talk about counseling and written consent, and you can see that the extent of the assessment is different in different provinces, and the promotion, again, commonly advertising is mentioned, and the detail thereof, this is where the report then will expand on what kind of advertising. Sometimes it's there, sometimes it's not there. When data was collected, the disaggregation of data, we had this document submitted that we just pasted as they were PDF documents. If we look, this is the district and the terminations in terms of gestation and the financial year. So although the format is different, but the information provided is similar in terms of the way it's provided by different provinces in terms of disaggregated data. The barriers, again, Honorable Chair and Honorable Members, are pretty much similar to others. In terms of including TOP questions during job interviews. These were the 3 questions that were asked, and the detail will indicate similarities in terms of what I have presented, depending on the relevance of the job. These are the questions that are asked. Public education, again, in terms of whether there are proactive measures when it comes to awareness raising. There are consultation with the pregnant persons under the age of 18. It's not like that of older persons. So it's almost like they contextualize in terms of educating. It would be interesting to find out what they say to under 18s and over 18s and why the difference and so forth. But then again, that's a topic for another day. Disaggregated data, as we can see, is provided in terms of annual statistics. The complaints handling, again, is similar. KZN, perhaps to say the services, 39 hospital, 14
complaint handling is similar in terms of provinces or in terms of how CGE is dealing with complaints.
No, the complaints of the facilities that provide terminations. So the question was, how do you handle or how do you manage complaints? Yeah, so there are those differences.
Okay.
Yes. Yes, there are similarities, more similarities than differences in terms of complaints management regarding the duration. You have 72 hours in respective and 25 days in other provinces. KZN, I was indicating
network problem again.
Sorry, ma'am.
Sorry. I was asking network problem again, or it's from my side?
I'm not sure if other honorable members and my commissioners can hear me.
Yes, we hear you. Oh, okay.
Thank you, Honorable Chair. Can Honorable Chair hear me now?
Yes, I can hear you, CO.
Okay. KZN, I was highlighting the number of hospitals and community health centers, 39 and 14. Noting this is one of the biggest provinces with the biggest population and vastly rural. So those numbers must be seen in that context. They told us that the facilities are adequately resourced. They are to expand on the 53 facilities being adequately resourced. So you have plans to expand on the facilities, obviously taking into cognizance the size of the province. The facility hospitals and community health centers that provide the TOP services, you have 24-hour maternity services. So these are the facilities that I have provided, which is a progressive finding that they provide 24-hour services, compliant with the requirement of TOP. And again, this is where, Honorable Chair, to expedite, I would say you have compliance with the national guidelines, but you have those weaknesses where improvements can be made. These are the prescriptions of the Act as compared to what the province is providing in terms of the services, the TOP services. Skipping to the funding model, just again to highlight, it's again that issue of the voted funds, the referral system. It's pretty much the same, although they give the detail of how ambulance services and private transport is utilized. The mechanisms in place to give TAP during the last week of the first trimester. And again here, in short, it describes the prescriptions of the law in terms of your 9 weeks medical termination, 12 weeks and 20 weeks, and the circumstances surrounding that. And here, I think we listed the provisions of the Act in comparison to what the province is doing. And the detail will show that, as I said, there are certain guidelines that are adhered to. There are areas where you will find those weaknesses. And the issues of curbing the bias, the issue of engaging policymakers. So here you get a detail where education in this regard is not only to the public and the service providers, but it also goes all the way to engaging those who must allocate the budget, for example. And again, that continues in comparison to the law, the Act itself, and what the department is doing. In terms of the assessment, again, Honorable Chair, there are slight variations, but similar to what I have presented. The promotion, again, the service is conducted in facilities that are accredited. So it's like you have education sessions in those facilities that happen during operations. The recruitment, again, here you have the questions listed, but again, in detail, it's the same, that those who are applying for jobs that are perceived not to require providing the service are not asked the question. And I had indicated, Honorable Chair, earlier that these services are cross-cutting from funding to actually conducting the procedure. The qualified staff per province, it's detailed, per facility, is detailed there. I don't want to read through it. As you can see, it varies from 17 to 7 trained staff. And then obviously what informs that may include the size of the community or the size of the facility, public education, commonality, disaggregated data, annual statistics, complaints. Again, you have the flow charts on the walls, and these are the commonalities that you pick here. Slight differences in terms of detail. Mpumalanga has 28 public and 2 private facilities. Perhaps to skip to the funding model, which says it's a women's health program, and I have also spoken to that. The referral system, again, is the guidelines with slight variations in terms of how these guidelines are implemented. The assessments, you have qualifiers in terms of what the client is being examined on, and these are the variations. Promotion, again, you have through community services, 56 health workers qualified to provide the service in Mpumalanga. the statistics provided below does not add to the total number above. And that those are some of the things where you get different information in terms of reporting verbally when you see the questionnaire and also follow up the verbally, you get differences. And this doesn't mean that there is anything perhaps suspicious, but sometimes when information is presented from different sources, there is that risk of differential presentations of information. And we can see that in terms of the number of terminations provided, the hospitals are listed, and it's just the hospital and how many were provided, which when you look at the numbers, hence we are highlighting that they don't tell you. And this in public education is similar to others. Disaggregated data is provided according to these three categories in terms of gestation, the hospital, and the year and the number of terminations provided. The barriers, Honorable Chair, I can skip because again, it's where you will find. Honorable Chair? Am I cutting off again?
I was, yeah, from my side, but now I can hear you.
Okay.
Yeah.
Okay, I was continuing on Pumalanga and barriers and just skipping to say it's common information and the stats they're provided annually. The recruitment of staff, again, it's similar findings. Complaints management, it's also similar findings in terms of the suggestion box and also how many complaints were received, where we were told only 2 were received at the time that we were conducting the study, the issue of participatory principle and so forth. In Limpopo, to highlight that there are 55 facilities providing the service. They have 25 primary health care, and I thought I will provide this in a breakdown because PHC is important in terms of comprehensive provision of services and 30 hospitals. So these are the 55 facilities in all. So each district has between 8 and 14 facilities in Limpopo, and also I want to try, and they have provided, you know, the populations they are serving and so forth. And this is where information becomes helpful because you say, with these people, how many terminations do we normally get and what resources are reasonable for this? The funding model, again, it's that ballpark or on healthcare service delivery, where the equitable share, we don't know what informs the allocation, the referral system, the standardized referral form, and this is in line with the guidelines of the national department. Of course, not 100%, but these are those variations I keep referring to. The assessment of patients, non-mandatory and non-directive counseling. So we can see here that the variation in some, you remember where we asked specific questions around this. Is this not mandatory? And we didn't really get the response. But the guidelines provide that you counsel a person, you let them know what is happening in what they are requesting. So these are some of the variations that some of the service provider feels this is not mandatory. The promotion of services, again, you have commonalities as presented, and also the gestational period for terminating with here is provided in terms of the facilities and also the years and the numbers that were provided per year. Of course, a different format again, but these are some of the slight technical differences in the presentation of information. the barriers, the recruitment, the issues. When you talk recruitment, people quickly jump to the unwillingness of health practitioners, and also the fact that they ask questions where the job is relevant. The issue of complaints management, Honorable Chair. Also, you have the commonalities in terms of your posters and so forth, and they indicated they received 104 complaints in 2019-20, the previous year of this study, and this was about health workers not adhering to Batubili, and out of these 96 were resolved, and that one would say is a good thing, the high percentage of resolution. Honorable Chair, towards the end of the presentation, we present the general findings, and these are like based on the commonalities of the findings that I have presented from different provinces and different facilities. And I wanted to jump straight to recommendations, because going forward, these form part of our performance in terms of following up on the recommendations. We feel that all facilities should conduct services, all health facilities, to facilitate the expansion of availability as well as access. And these apply to the department. These are some of the recommendations that we are making in terms of making the services available and accessible. There are issues of record, and record I will expand, including the disaggregation of data, standardization of processes across facilities. Those records are important to help those involved in providing services or in providing decisions on the services to be able to decide on how to intervene. The issue of the willingness, and here for me is continuous education, generally around issues of gender issues, gender equality issues that are embedded in our psyche, so to speak. These are issues that require general continuous education that actually in all our responsibilities, so to speak, that education continues because it's a gradual mind shift. Kind of a situation that we are dealing with. Also, the increase of budget to allow for more facilities, speaking to that issue of equitable share, that it must be based on evidence how we allocate, so that we allocate adequately and equitably. Prioritization on more sensitization, I think I just spoke to that, Honorable Chair, and this is the end of the presentation. Thank you.
Thank you very much, CEO. I'm not sure, honorable members, whether we allow the CEO to present the second report on the government's emergency responsive action plan on GBV. What do you suggest? Can I get hands so that because these two reports are very much important for us to deal with today. Any comment? Or you want us to engage on the first report? Honorable Masigo and Masondo?
We also, speed up the presentation process so that we do get enough time at the end to make the comments and the questions.
Okay, so the CEO must present the second report.
Yes, Chair.
Okay, Honorable Masondo, were you seconding Honorable Masigo?
Yes, I'm seconding her.
Okay, thank you very much, honorable members. Let's continue. CEO, may please present the second report on the report on government's emergency responsive action plan on gender-based violence and femicide.
Thank you,
Try-
Honorable Chair.
Yeah. Try
Yeah,
to yes.
Sorry, Honorable Chair. This is a shorter presentation. I'll try and run through it. But I want to check first. Gadgets can be sure if it's projecting.
Yes.
Thank you, Chair.
Yes.
I will just again give a quick background that this project was put in place following the Women's March against gender-based violence. I think it was in 2018-19 now, and obviously there was an emergency response plan put in place by the president that was supposed to be conducted, interventions to be conducted by different departments in the country. And here we're talking about when the implementation of the plan started and when it ended, and when the CGE conducted now its assessment of the implementation of the plan. Quickly in terms of the methodology, just to give a context of the following slides, the study, as I have said, was to assess or evaluate the extent to which progress was made in terms of implementing the plan that was put in place by the president, a post hoc review and assessment of ERAP initiative after the implementation or the completion of the project at the end of 6 months. The auditing approach was taken where we assessed performance information from implementing agencies, which are government departments that were allocated this against the targets that were specifically allocated to them. So the ERAP action plan had 39 specific interventions, a total of 80 specific targets, a total of 22 governments across which these responsibilities were given. And then you also had entities such as the labor unions, political parties, non-state actors, and so forth, assigned specific responsibilities to support the implementing agencies, so to speak. Continuing on this, the assessment was information intensive, and we'll see as we go down what this means. And we depended and relied on accurate performance information collected and compiled by government departments to be able to make conclusions. And again, it's that emphasis that says what we report is based on the information that we received, which doesn't mean things were not done, but the information we get is what we present. And other alternative sources for this study, we looked at different online information and sources, media reports, just to cross-reference what is reported in different sources, and also reports by independent institutions, because Honorable Chair, Honorable Members, and my commissioners, you will remember that this was an issue of major interest in the country. The Interim Steering Committee on GBV also released a report on ERAP in April 2020, which was an important source of information for this assessment for us as the CGE, because this is the committee that was established specifically to look at this process. And some quick challenges that are also common. This study was done.
CEO.
Yes, ma'am.
Your research was basically done depending on the reports that were done by other people, meaning whether it's on the news.
Okay. Yes.
There was not a physical, or also here you had a questionnaire, or you may. Yeah, I'm interested in the sample.
Yes, actually, some of the challenges and limitations will indicate that. But just to, Honorable Chair, to answer quickly the question is that, again, we use different methods to get data. So the first source, let me not say the first, but one of the sources is getting government reports that they have written in terms of their implementation of the action plan. And then we looked at the report written by the steering committee. And then to cross-reference, we looked at other sources. So we looked at reports written in this regard by other interested institutions. What was the media reporting around that, just to cross-check different aspects that informs what is happening around the implementation of the action plan. So the information we are presenting, where the report does say where this information was found and how, and just to give a context.
Yeah, our interest also is that in relations to the information that you got from other sources, did your researchers went to verify the facts or what?
That information was to verify the facts across the reports. So if we had a report from the steering committee, a report from a department, and we look what the department is saying, what the steering committee is saying, what another interested person is observing. And so we are these the same? Are these different? Why are they different? Those kind of things. So we report those differences and what we found from the reports of the departments, what we found in different sources, and say this is the conclusion. So the findings here are based on what departments reported. So you have those key information sources, others just to verify the experiences of other interested parties in this information.
Yeah, it's because the reason I'm raising all these questions is because we want to be sure that the information that is presented before us is accurate, and we know what are we dealing with, rather than depending on information that was sent and it was not verified by yourselves.
Yes.
So yeah.
No, thanks, Madam Chair. Definitely. Hence, I keep saying our report present what we had at the time of the study verified, and and also that this is the information we have. In terms of the challenges, which will expand perhaps to the question, obviously this is one of those studies that was carried out when the pandemic started, and access to people and information like the previous study, sometimes what we perceived as reluctance or because of the delays in terms of getting the information that was requested. And what Madam Chair is talking about just now, the issue of reliability and the accuracy of information provided. So that cross-references to try and support the reliability and validity of the study. And we also report on the information on the abolition of the interim steering committee when we were conducting the study. So as I think I've spoken to this when I gave the background to the ERAP, the responsibilities for interventions given to different departments, the interim steering committee having the overall responsibility for ensuring coordination oversight, accountability of the implementing agencies, which were the 22 departments plus other entities that I had listed. Also, the responsibility of the committee for key decision making, such as goal setting, prioritization, determining strategic direction, focus funding, and all those things that would facilitate effective implementation of the action plan, and also the responsibility to liaise with funders, donors, community-based civil society organizations for reporting, accounting to Parliament, and hence even our approach was to, to compare information from different sources, because even the action plan itself, it needed collaboration between different stakeholders for it to be implemented effectively. So the overall implementation was characterized, and this is like your broad observations of the commission following cross verification of information received. The implementation was characterized by inadequate operational coordination of departmental activities across the thematic areas, the interventions and targets. We know there were thematic areas that were broken down into different indicators and targets and so forth, allocated to the relevant departments and other implementing entities. So you didn't get that cohesive way of implementing the action plan when you looked at the information at hand, and the thematic areas placed greater emphasis on long-term qualitative policy outcome for the country for dealing with gender-based violence. And this is another broad observation because this was a 6 months emergency response plan, but it had long-term and this is true. There were areas that needed the gradual change in mindset that I keep referring to. So within 6 months, 27 years into democracy, we haven't achieved that. We have achieved a bit, but not as much as you do in 6 months. So the accompanying targets tended to place greater emphasis on short-term quantitative outputs. And again, Honorable Chair, I don't want to labor on what could have been done better, but there are some findings that can be justified even when things didn't happen the way they should have happened, because the conditions didn't allow for that to happen in that way. An example being this thing of long-term qualitative policy outcomes. So many targets in this plan were not based on a clear assessment of existing institutional capacity needs of responsible departments. And again, an emergency plan was the ground laid for this plan to be implemented effectively. Those are the questions that we're taking into consideration. So this resulted in many targets not being met because the scope of the work exceeded partly exceeded the institutional capacity in place. So the original ERAP documents did not make provision for systemic ongoing monitoring and evaluation assessment of progress in the implementation of the intervention. Therefore, the planners, it appears, did not provide a mechanism for post-implementation impact assessment regarding the 39 interventions and the 80 targets on the thematic areas. And the committee issued its own ERAP report, as I have indicated, which this for us was seen as a progress report rather than an assessment of impact or an M&E report. And these were our observations based on that information. So in terms of the thematic areas overview, this was for the Department of Justice. It was about improving access to justice, and following the entities assigned their responsibilities under this theme, and they are listed there, including the presidency and parliament. So these were the entities responsible in this theme in the broken down targets allocated to individual entities. So the overall performance information for interventions and targets under this thematic area was largely characterized by issues of accuracy and reliability. And that's what, of course, as we look across different information, the accuracy and reliability of the information was not conclusive to say this is valid, this is accurate, this can be replicated, for instance. And some of the reported achieved targets could not be verified on the information that we had as we made the cross references. The information contained in the committee's report, we found that in what we were looking for, we found that it was limited for assessing issues of progress and achievements. And I think when you didn't do an impact assessment of the interventions, it becomes difficult to say this progress happened and what did it lead to. And I think that's what we are reporting at this stage. So the key highlights under this thematic area, and here is where I usually say one doesn't want to paint a gloomy picture because there are some good things that have happened. We all know that the 3 bills were developed and now they are at a very advanced stage in this process as laws ascended to. The sub-liquor establishment compliance inspection of 84,000 inspected and 1.3 illegal outlets closed. So there were things that were happening, and when it comes to some key targets that were not achieved, the establishment of the national coordinating structure at the time of this study couldn't be verified. The vetting of all state personnel working directly with children and mentally persons with mental disabilities. So a small number was done in this regard as opposed to the target. And the focus of this intervention was vetting against a sexual offense register. And there was lack of focus on other threats like lack of skills, training, expertise, care, and funding. So those were things that were the weaknesses in this regard. Many targets under this area were not achieved. And as I go, we will, there in the report, there is a table that say what targets for which department and what was achieved partially and fully and not in terms of detail. Under the second thematic areas, norms and behavior through high-level prevention efforts, and this is what I was talking about, a gradual paradigm shift, long-term kind of area, where although some activities were conducted in terms of behavior change, obviously we cannot expect our beliefs or something to change overnight. Hence, the advocating for continuous education. The departments allocated here are listed there, including the departments of education and other GCIC, which are some of the key departments in this area. In terms of the overview here, there are some departments such as the Department of Higher Education and Basic Education provided comprehensive information on progress achieved, especially on educational campaigns in schools around prevention. And those campaigns need to be sustained. I think, again, this repeats what one keeps saying. Campaigns, interventions to change behavior norms in the workplace, the Department of Employment and Labor also did that work, which again needs longer time frames than 6 months. But this thematic area was characterized by claims based on inadequate information from some of the entities. So yeah, when you talk to people, again, this is where it becomes tricky in research. Hence, you need to cross-reference because we all say things the way we perceive them. And I think that is one of the limitations when you conduct research. The urgent response to victims of gender-based violence, the central focus in this area was on short-term urgent interventions in responding to GBVF by providing access to emergency support services through improved responses, improving effectiveness of these systems, processes, and practices. And we know when we talk about barriers around these issues. So the emergency response was trying to put a finger on this thing and say, let's improve on this. And the departments listed there were given that a responsibility, and we got insufficient information on progress on these targets. And again, I will refer to the tables in the report in terms of the detail, what wasn't achieved and what was not achieved. Many of the targets were only partially achieved in this thematic area. The available performance information provided was insufficient explanations as to why targets were only partially achieved and not achieved, and lack of accountability. So these were our observation in terms of the responses that we got. An example there is given that the target to recruit 650 social workers by 1st December 2019, only 200 were recruited and later than the stated time. So the explanations as to why, because one will want to imagine that if we say appoint 650, and this is not necessarily the reality, but I would imagine I would give you a budget to appoint 650. Hence, some of the reasons in this study in terms of achievement refers to budget, and why were only 200 appointed. The NPA's recruitment of 74 prosecutors was highlighted that exceeded the target of 50. So here's a good achievement that we are reporting, but many targets under this area were not achieved. So you have a target where there was an overachievement, but it wasn't the only target allocated. So many of them were not achieved. The strengthening, thematic area 4, strengthening accountability architecture. This is one of those that entailed a medium to long-term goals beyond, conceivably beyond 6 months, I will put it that way. And the performance against this target, given the context, as I'm saying, long-term, medium-term, was poor in that sense. Not a single target was met in a satisfactory manner. Many unrealistic targets and timeframes were set. And if we look at this context, one would deduce why some of the targets were not met. Honorable Chair, can you hear me?
Yes, I can hear you.
Okay, yeah, I'm going towards the end of the presentation. I just heard the sound coming.
But I don't know where it's coming from.
Oh, all right, I'll continue. Another, for me, big area where we really need to improve is collaboration and coordination of the collaboration between different duty bearers, because our roles are interlinked in different aspects of our work. So that was found to be not satisfactory as we were doing the study. The overview in terms of thematic areas, mainly the intervention were not achieved. The interventions that were not achieved, the establishment of the coordinating mechanism to serve as an accountability mechanism on combating GBV was not achieved. establishing a multi-sectoral coordinating structure on the national agenda for 6 years. Not much progress was made that. Some of the interventions were to forge greater interagency collaboration, establishing task teams at national and provincial levels. And I think this relates to what I have just said around collaboration and the interconnectedness of our responsibilities as different entities of government. The interagency task team were aimed at facilitating provision of agent support services for victims of GBV. Such interagency task team appeared to have had limited success. And some of the explanations for this, the report details what were those limited successes as we summarize in PowerPoint here. Excuse me. Thematic area 5, to prioritize interventions that facilitate the economic opportunities to address women's economic empowerment. And this is one of those long-term goals, but the central goal here was the provision of economic opportunities, the short-term goal for women and girls, because we know this is long-term, but there are short-term interventions that can be made. And if I were to make an example, Honorable Chair, using the presentation last week when we're talking about procurement, those are some of the short-term interventions that can be made, and the departments are listed there in terms of who has allocated this. The short-term targets specified included the verification of existence of relevant policies in the workplace, such as sexual harassment, the creating job opportunities for women and girls, introducing preferential procurement, what I just mentioned as an example. So those are some of the short-term goals. Also key long-term interventions and targets to secure economic empowerment of women and girls, issues of land being some of those long-term goals, national budget reorientation, and here gender responsive budgeting becomes key, and that's why one is excited that the country is taking that approach seriously since it was first introduced many years ago. The land reform program entails complex policy issues, legal issues, so these are those issues that are explained as long-term and not reasonably achievable within 6 months. The Gender Responsive Budget Framework Initiative was already on the agenda of the Department of Women. And here is why I'm talking about how now we are pushing this. We had started, but we are continuing to push this initiative in terms of gender responsive budgeting. And this does indeed need greater cooperation of all key national ministries, including our Treasury, in terms of allocations, in terms of priorities when it comes to programs that include women's issues, especially gender-based violence issues that are now a pandemic. We cannot turn a blind eye in terms of resourcing this area of work. Just to emphasize in that work, in that area, that the performance of the department under this thematic area was unsatisfactory in both the short term and long term. And I think in my introduction in the thematic area, I did indicate some of the justifying factors around this situation in terms of implementing a 6 months emergency response plan. Yet, we must acknowledge that there were things that could have been done better. And yeah, so the process is still underway. We are still experiencing difficulties, but we have conducted a study in this regard. And Honorable Chair and members will remember that we do have in our APP a research project that follows up on the implementation of the GRBF framework. Similarly, not much evidence of progress was achieved in terms of the land reform program, and I have explained that in terms of the 6 months cycle. The summary of achievements, we had reported this out of 80 targets, fully achieved were 17, 12 partially achieved, and 51 not achieved. And in conclusion, although this study was timely and appropriate, we know it was responding to a very worrying issue in the country, but the lack of effective coordination. And in the beginning, I talked about how the aspiration to intervene were not aligned with what was on the ground in terms of resources. These are some of the weaknesses going forward we need to attend to. So the issues of coordination, issues of oversight and accountability, issues of ongoing program monitoring and evaluation are the lessons we're taking from this study, that when we go forward with the interventions, we don't leave them behind. So this contributed a lot to the non-achievement of the targets. And the committee role was crucial, but the operational issues, lack of role clarification, all these things, limited capacity, they do contribute to the effectiveness of a structure if these things are not handled in an effective manner. A large number of departments involved in the implementation of the plan were without effective operational coordination and collaboration across the thematic areas. Hence, the recommendations was that government undertakes a thorough review and evaluation of the implementation of ERAP. And we were saying this because internally in the CGE, when we discuss these projects, and we know there have been comments that ERAP was 6 months, ERAP is over, we're not working on ERAP anymore. But for us as the commission, we say gender-based violence is not over, we're still working on it. So that it was a 6 months response plan does not mean the work stops when the 6 months are over. Hence, we
you're right. Yeah, right.
Thanks, Chair. So the recommendations for us as the CGE stands that we continue with this work. It may not be the ERAP. ERAP have taught us lessons. We continue and learn from those lessons. So while we do the monitoring of the implementation of our priorities as a nation, other implementing agencies need to also assess their own performance, monitor, evaluate, and self-respect. Self-evaluate to be able to improve on their interventions. So that is what this recommendation is talking about. It's not taking the responsibility of the CGE away. So reviewing, evaluating, continuing with this work should be carried out by competent and independent service providers. We know in the country we have experts who have opted to do the work independently, and these are the resources we can use given our of course our budgetary capacities. Many things will inform the implementation of these recommendations, and we need to take into consideration what are the feasibilities of implementing these recommendations. So given that the interim steering committee was I would say dissolved perhaps in April 2020 for the purposes of what it was set up for, we recommend that in the short or medium term, the overall responsibility to drive the program of intervening in GBV, and I think this is the case, is placed under a competent structure or department that will oversee the national programs, including the process of establishing a national multi-stakeholder body on gender-based violence. And obviously, we do know that some of these processes are underway in terms of developments that I'm not reporting on here, but just giving a context to the recommendation. And we also recommend that priority, including the necessary resources, be given to the current process of establishing the national multi-stakeholder body on gender-based violence. And we feel that it's necessary, the necessary legislative process must be initiated to ensure that a multi-stakeholder national coordinating body on gender-based violence has the requisite legal standing and access to regular funding. And as the Commission, we are a critical stakeholder, and we should engage with the Ministry for Women in the Presidency and other relevant stakeholders regarding planning processes and timeframes for the establishment of the multi-stakeholder coordinating body, relevant as we were putting this recommendation together in cognizance that things have developed at this stage. So the NSP has been approved. The implementation should be the responsibility of the multinational stakeholder coordinating body. And I think these are some of the discussions that are already being implemented, so to speak. So while we process, the process of establishing this coordinating body is still underway. And for us, this recommendation was from that basis, the responsibility could be of the NSP be placed under the ministry, where I think it is in its right place anyway. So it's recommended that the Ministry for Women in the Presidency to initiate a consultative processes for planning again at the time of making the recommendation. That's the situation that warranted this recommendation. And I will keep repeating, bearing in mind current developments. So one of the key interventions in ERAP was to, yes, ma'am, I think.
I'm worried when you are doing a multi-stakeholder committee to be established, because you see now what they are doing, they are planning to establish a GBV council. And what they've done, they've appointed a secretariat as we speak, for starters, that at least there must be a structure so that when they are done with that establishment of a council, because they have to come up with a bill of establishment of gender-based violence council, and then when they finish to appoint it, at least there'll be infrastructure already where the secretariat will be doing the administration work for now. So, because we don't want to see a situation whereby another interim structure is established. Because when they continue to establish interim structures, they won't finalize the issue of gender-based of the council. So I'm sure what you need to do also as CGE is sit down with them and check on the developments that they have, progress made in terms of establishment of a council. So that I think that's all what we need to push for, all of us, than establishing another interim structure which will take another year. I'm sure even yourselves, you'll agree with me. Guti, let's push them to establish, to facilitate into your establishment of a council. Because there's already a secretariat. And I was interested in hearing in your report on, have you monitored what the secretariat is doing currently?
Shall I come in, Honorable Chair?
Yes, CEO. Yes.
Yes. This current study observed the 6 months action plan. So as I was saying, in our APP, we have targets that continue. And I think it speaks to the second bullet in this presentation that we continue to monitor the interventions. And we have a project where we're monitoring the implementation of the NSP. I have mentioned the GRB framework and so forth. So I think for us, and this is the project that mid-year we reported that we were still collecting data. So the report, when we finalize it this year, will show us what the status is, and we will report on the status on our monitoring of what is happening. But Honorable Chair, may I say, with the guidance of the Commission, maybe what Honorable Chair is saying are recommendations in terms of how we move forward monitoring this work, perhaps what kind of questions we should focus on. I don't know, I'm trying to, because I hear the Honorable Chair and I feel we need to embrace the questions and the advice we are getting and strategize on how we continue as we continue monitoring the implementation of these instruments.
Yeah.
Thank you, Honorable Chair. I think this was the last slide.
Okay.
Shall I continue, Chair, as suggested, to the next presentation?
Continue, CEO.
Okay.
Yes,
ma'am. I'm just going to the CEDAW report. Sorry. Where is it? Honorable Chair, the CEDAW presentation is on PDF. If I may be allowed, it projects differently. If I may be allowed to quickly identify it.
Yeah, you can remove the document that is on the screen now.
Yes. Bear with me. Stop. Chair, bear with me. I'm trying to stop sharing. The computer is responding slowly. Is it projecting, Honorable Chair?
Yes.
Thank you.
Yeah.
Again, if I may quickly skip the introductory slides, because this presentation is slightly longer than the previous one. Yeah, and just go to the actual work. This slide is just talking about when CEDAW was enacted, when we became signatory, that kind of background, and why we need to, as a country, comply to CEDAW. So in terms of the methodology, again, just to give a quick context, we used again, similar to the ERAP, so to speak, because remember, departments report on their performance as it relates to their implementation of regional and international instruments that we are signatory to. So in that regard, we used their public sources and other available information, specifically from government sources, as I have said, the reports that pertain to their implementation of CEDAW. And we also got information from the department's website, their annual reports, official documents to establish the progress that different departments have made in implementing the recommendations and as articulated by the concluding observations from the last periodic reporting of CEDAW. I don't want to speculate on the date because I almost mentioned the year. I will leave it there, but it's in the presentation when the last reporting period was, when the recommendations were made, I think 2011 or thereabout. So we were monitoring progress from that context, from these different sources of information. The information was verified through direct contact via telephone calls and emails with officials from the relevant departments and other related organizations. As we will know, Honorable Chair and members, we also have shadow reports from the civil society organizations. So all this, as the Commission, we want to see who is saying what, especially because when it comes to these issues, they are contentious. We all have different perspectives in terms of what is happening, how effective are we as a country. As an implementer, I will feel I'm effective. As a recipient of the service, I will have a different perception. So these are some of the issues that were taken into consideration as we were compiling this report, mainly to assess the progress the country that has made in terms of compliance with CEDAW as per our commitments, to also assess our progress in implementing the concluding observations, as I have said, emanating from the previous periodic reporting, and also to assess gaps and factors hindering implementation of the convention. And just quickly, in terms of the limitations which are really nothing new, if I may put it that way, when it comes to conducting our work as it pertains to getting information from the implementing agencies, that much of the necessary information was not freely and easily available. And I think we reported that with the ERAP as well and other projects, because we ask sensitive information where, as implementing agents, some of us don't want to be seen not to be performing. So that information is not volunteered very easily. The information around gender issues was not readily available. And again, it's the same issue of sex disaggregated data. And I would add gender, sex, race here becomes an issue, because we know how our services are differentiated in terms of access by different groups of people in our country. The plans, most of the departments lack specific data necessary for compiling reports on budgets and so forth, gender sensitive budgeting. And generally, when it comes to gender issues, I think for me as a country, people would say, as a 27-year-old democracy, we've actually done better than 100-year-old democracies. And I commend the country, our country, for that. But that shouldn't blind us to the fact that we are unique in terms of inequalities in the country. We have a unique history compared to other democracies. So we need to still focus and say we've done well, but we need to still address issues of the disparities that the country accumulated through the apartheid system. So these are the kind of situations where I always put emphasis. The difficulty in obtaining relevant data on time, again, was one of those limitations that we experienced. Sorry about that. The findings on the articles. The definitions of discrimination against women for the purpose of the convention, the purpose of CEDAW, discrimination against women means any distinction. And Honorable Chair, if I may perhaps skip this one, because the definition really, as per CEDAW, is defined in the context of what CEDAW wants to achieve. So as it stands there, it's something that we have. And as government, we reported some of the policy and legislative frameworks during the last country periodic reporting that also it's 2009. And here I want to say this, in a sense, says we responded to CEDAW in terms of the policy environment. And that is true. We have observed in other work the kind of things that we've been doing. And again, this is not saying it's perfect. We acknowledge good work and say we still have more work to do. The involvement of Parliament in the implementation of the convention and the concluding observations. Here, some of the work of the National Assembly relating to the implementation of CEDAW Committee concluding observation and recommendation was reflected through work of various internal parliamentary committees and other relevant structures. And one would dare to say this presentation is part of what this is talking about, the previous statement that I have just made. So the portfolio committee, this honorable portfolio committee of the chair and members had two sessions in 2015 and 2016 to deliberate specifically on the country's fifth periodic report on compliance with CEDAW, the 2011 concluding observations and recommendations. And I think this is what I was referring to earlier when I mixed up the dates. The committee was focusing on ways in which the issues raised in the report could be addressed. Our country report, I want to believe. And the committee has obviously an oversight function. And one of the key interests has been violence against women. So as we will see as the presentation continues, how we're doing in that regard in relation to CEDAW, considering that the previous presentation is also, if you want to look at a big picture, also gives us how we're doing around the issues of violence against women. A series of events in partnership with civil society have led to the adoption of the NSP, as we know. Home Affairs Portfolio Committee responsible for oversight of the Department of Home Affairs, mostly for ensuring implementation of Article 9 of the CEDAW, the Health Portfolio Committee. So these slides, Honorable Chair, lists departments that are responsible for different articles in the convention. And this is part of the findings, just giving that background in terms of how the convention applies to us as entities of government and how we have done in that regard. And maybe with that short background in terms of the responsible entities and the articles, if the Honorable Chair allows me, I will try to scroll down to the actual findings because this is also, as I've said, another very long presentations, Honorable Chair. May I do that? Honorable Chair, can you still hear me?
Yes, yes, I'm agreeing with you.
Thank you, Chair. So the responsibilities of the gender machinery, we know the gender machinery involves every entity responsible for different coordinating the gender, addressing issues of gender equality in the country. Article 3 that speaks to the issue of human rights and fundamental freedoms, with Ugutwala here been used as one of the areas that as a country we have been focusing on. And I think the section I just presented in the previous slide now talks to the articles that relates to some of the legal frameworks that we have, or the legal frameworks that we have already established in the country in response to these articles. And we can see the list there, the criminal law, the sections of the law, the recognition of customary marriages, due to specific, maybe to highlight that due to the lack of specific laws against Ugutwala, the African Law Reform Commission compiled a discussion paper and is currently, and when we say currently, I must say developments have happened, but at the time of the study, we were saying currently developing a bill in this regard. And then the proposed bill had not been submitted to Parliament. And here we're just saying, you know, these are some of the situations where we say, as we try to implement difficult issues, women are undergoing difficult issues. It doesn't stop and wait for us to finish what we are doing. And this is there's no value judgment here, because we know we have systems and procedures that guide how we do things. But just to mention that we need to be cognizant that as we speak today, women are being killed and raped. Therefore, there is a need for us to expedite some of these interventions that we are putting in place. Also, the recognition of polygamy in South Africa. These are recognized as protected. These are some of the things that we have done to respond to the convention. But Section 7.1 of the recognition of marriages was declared unconstitutional. Again, this is a democracy. People must be heard. All opinions must be heard. We know different clauses of our laws get challenged when certain cases that perhaps we didn't know about when we developed these laws give us lessons that these things need to be under the law for people to be protected. So laws are being amended and so forth in that regard. The killing of witches, and this is where, honorable members and chair, if I may be allowed to repeat myself, this is where I was saying, as a 27-year-old democracy, we've done well, and some people will say better than democracies that are over 100-year-old, because when you look at the things that we have done under each of these articles, you can see that we really have worked, but we just have to remember that our situation is unique. The killing of witches, you know, with its history and all those kind of things, we as a country, we have put together interventions and legislation, obviously, to prevent those things from happening. And I dare to repeat that now the test stands in the effective implementation of these laws that we have put in place. The FGM situation that exist in South Africa between different population groups in our country in different ways. And again, these are some of the situations that through our laws, just to mention Pepuda as one of those that seeks to prevent discrimination on the basis of gender. The temporary special measures in terms of Article 4, the latest country periodic report also omits to mention the Commission for Gender Equality, which is a constitutional body established together with other institutions that promote democracy under Section 181 of the Constitution. And this is a point just to make, because as a constitutional body, it's one of those chapter 9s that are mentioned when it comes to reports of the country. But again, value judgment cannot be put here because the report would perhaps clarify why this was the case, whether the CGE needs to do something, because for me, it comes back to us when it comes to self-reflection. Why are we not recognized? What are we not doing right for us as a commission not to be recognized, given our mandate that is elaborated in the second bullet there. The issue of sex roles and stereotyping, we have developed in our report, we reported that we've developed a medium-term strategic framework that comprises 14 outcomes that focus on nation building and social cohesion. And these honorable chair members will know that some of the things that have been presented from different, two different portfolio committees in terms of the country's progress as it pertains to certain specific projects that we have been responding to committees on, including strides that have been made in different sectors in terms of transformation, be it in higher education, in the workplace, and so forth. So that, yeah, I think the issue that the research is replete with examples is just what I was alluding to. Also, including some of the research is conducted by other institutions, and this is a combination again of our progress as a country, because for me, when we talk about the country progress, we not only look at what government is doing, we all are together in addressing these issues. Hence, complying with these instruments is everyone's business, so to speak. The issue of sex role stereotyping, there are interventions, and from other presentations, we would have noted that the issues of LGBTQI plus people and people with disabilities, but with emphasis to women with disabilities, because we know how the hierarchy goes in as far as discrimination is concerned. It's, for example, LGBTQI in the majority, women who are killed for being who they are. So there are interventions in place, but as a country, we need to also focus where some of these issues are exaggerated in terms of the demographies of people in the country. This continues, honorable members, if I may be allowed to skip some of the articles that continue in detail, but still just showing more laws or more interventions that we've done as a country to address the issues, just to expedite the presentation. Article 5 continues, and I think it becomes the longest because it's where we have the major issues. As the country, we have declared these issues as a pandemic. Hence, you can see even in our reports, they stand out. Issues of gender-based violence, and in the previous slides, contextualized to people who continue to be marginalized in a more focused way, where you will be killed for being who you are. So that is a more contextualized, serious situation, so to speak. But when it comes to gender-based violence, as I was introducing the report, I did say we will see that as we respond to the articles, we can see from other work like ERAP how we're doing as a country overall, and the developments that we have made after the 6 months. Hence now, we're talking about continuing in terms of lessons learned from ERAP, but this is the current situation. At the time of assessing the country for the purpose of this report, the situation was as listed here, that one of the key policy and institutional developments introduced by government in the wake of CEDAW committee recommendation was the establishment of the National Council on Gender-Based Violence, which was formally launched on 10 December 2012, initially before we talk about the ERAP in latter years. And I think we're familiar with that history. Of course, as a country, we respond with good intentions, but ERAP taught us that planning and laying a strong foundation to implement our good intentions is also a bigger part of how we become effective. So as we can see, our interventions are listed here, and also the development in terms of some of the weaknesses in terms of how the council ceased to exist in 2014 and so forth, and how now the work that we are doing, learning from these lessons, is trying to resuscitate these recommendations. Perhaps to just note the honorable chair and honorable members that what some of us appreciate about this country is that we don't stop. We fall, we get up, we fall, we get up, and we're learning lessons. We know now what to do better, so that for me becomes the key in these presentations that we are making. This slide again talks to what I talked about as I was presenting the ERAP report, the background and what we did as a country as we respond to these articles, including those issues that we were talking about, conducted by the Department of Education and other departments that are continuing to actually educate communities and change the mindset as it pertains to gender relations and respecting each other's rights as human beings, different as we are. Your issues of the 16 days of activism are some of the efforts where we're trying to advocate and raise awareness around these issues of violence against women, the mechanisms of accountability for implementation of the provisions of the policies. And this, for me, relates to what I said earlier when I say we have brilliant systems, legislative environment, and so forth. I just talked about the gender machinery now. If you look across the region, and one can dare say internationally, I don't think you can find a gender machinery established as we have done in South Africa. And this is just a comment not based on research or anything, but observation through doing this work, that we have these mechanisms, but we need to be capacitated to implement these mechanisms that are in front of us. And the issue of capacity cannot be underplayed at all levels. That it's one thing being the CEO of the CGE, it's another thing getting the CGE to do what it's supposed to do. And I'm just using the CGE generally, that as a country, we also need to look at the issue of capacitating people who are running these key gender machineries to be able to make our aspirations come true. The state of budgeting for implementing GBV related project, as we reported, is the same situation, unsystematic, not well coordinated, and so all those kind of things. And here we're giving one of the examples coming from KPMG, that assuming that 1 in 5 women experience violence within the year, the minimum annual cost to the South African economy of that violence is 28.4 billion. And when I read this elsewhere, this was, or they did say per year, yes, per annum, and it has gone up. It's been broken up. When you look at current literature, it's not just about a woman experience violence, 1 woman in 5. Now, lately we've been talking about a woman being killed in South Africa every 3 hours. And it doesn't only cost us lives, but it costs the country its GDP, so to speak. We're reducing human capacity, which costs money. Let me not preach, Honorable Chair, forgive me, but one gets personally involved when these things are raised. Trafficking and exploitation of, and I think this as a study that was done previously, obviously will come across words that we don't recommend are used anymore, and may the committee please bear with us for that. It's one of our old reports, but again, the country, it has put together interventions to address issues of preventing and combating the trafficking of persons. But we also know that the majority of those persons are women, and not ignoring that other men are not trafficked, they are trafficked. We're talking about the majority, and that matters, especially when it comes to interventions in terms of targeted interventions. We have a comparative study, so research and a lot of work is happening. And I know currently there are also work, or let me say discussions, led by some of our leaders in the country around these issues, challenges around monitoring, periodic evaluations, the collection of data. These are always things that we need to improve on, so that we know how much of a problem we are dealing with. And I know there are research work that has been done across the country by different institutions, albeit different kinds of findings, but they do give us a picture. But as interveners, we need to use this information to try and get focus and common understanding of the issues based on the key fundamental rights provided in the Bill of Rights, because these, like as we were talking about the termination of pregnancy, we're dealing with the fundamental human rights, where my beliefs have no place, because my beliefs are based on my own experiences or upbringing. We're implementing the Constitution, and I think that's what, as a government who developed this Constitution, that's what our focus is on. Here, we Honorable Chair and members, we're providing information again in response to CEDAW as it pertains to the representation of women in the National Assembly and generally in key decision-making structures in the public and private sector. So I just want to shorten it like that. As we presented the elections reports in the previous weeks, we presented this information and we discussed it. But for this purpose of the report is just to say these are some of the interventions that as a country we are, and I think this is one of the areas where we are deliberately doing something. Though there are variations between political parties, but as a country, we have different ways of addressing these issues. So, Honorable Chair, with your permission, I want to request to skip the representation part of this part of the presentation, as it's information that we have presented to the committee in detail in the past weeks. But if, yeah, I'll be advised if I can continue to the next article, Honorable Chair. Honorable Chair. I'm not sure if Honorable Chair has network
I think
problems.
we might have just lost the Honorable Chairperson. You may continue here.
Okay, so I can skip the representation of women part. I was requesting to expedite the presentation.
Yeah. Oh no, the Chairperson is back, but I think you can skip it.
I'm showing network, ne? Because I've been trying to say, no, you can skip it because you did present it last week.
Thank you.
But what I wanted to request you to do is that maybe don't read word by word, just highlight critical things so that you are able to finish your 62 pages. Because my fear is that we have presented 3 documents and we won't have enough time to engage as the portfolio committee. So if you may do that.
Yeah, yes, Madam Chair, thank you. Thank you, Madam Chair. Madam Chair is cutting. So if maybe if I may just continue, I got the advice to skip these issues of representation in public and private institution. We talk of the Johannesburg Stock Exchange. It's still about participation as we go through Article 7. Article 8, talking to international representation and participation, the appointment of women ambassadors, and these are like our participation in not only in international countries, and also studies that are done by international institutions that shows the women's participation in political life, including South Africa, organizations like the CPA, the Commonwealth Parliamentary Association. Yeah, forgive me for the acronyms that are mixed up, just to highlight how far we go in terms of reporting in this, in our performance around CEDAW. Article 9 speaks to nationality. We have put legislation in place as stipulated in the Constitution of the Republic on how nationality and citizenships are defined and how one qualifies to be a South African. And I think that just summarizes as a country how we define and implement these issues without getting into the details of how well we're doing as a country. Article 10, as we can see, the listed, I will say sectors where there are conditions that we must implement to transform gender equality in these And honorable members will note that some of these are some of the projects that we present to portfolio committees. And here we're taking that list one by one. But as I've been advised, I will just summarize that in terms of education, the bullets there list what we've done as a country, where we're improving, where maybe we're going too slowly, where we're doing well, and the detail is there with the numbers and so forth, including, you know, from what's the first stage of education, the developmental stage, all the way to higher education, how many women qualifies in which areas of studies and so forth. And this is one of the areas where I think we're doing well as a country, because now we can even see that young women or school-going girls, we see the statistics improving in terms of their enrollment into STEM and also their qualifications and further activities that they do after school. So if I may run to employment, again, similarly, this is where one will say we have the legislation. In terms of legislation, I think in the summary in the beginning, one has said we have brilliant legislation. So in all these listed articles in CEDAW pertaining to different services or sectors in the country, we have made strides, and there are weaknesses to be addressed, especially if you look at the previous presentation on the termination of pregnancy. You can see it pretty much for me in this access in this article in terms of access to healthcare, not only CTOP, but other services we still have to improve as it pertains to access, the availability and access to services for women. And ERAP showed challenges in relation to gender-based violence and so forth. So access to health with that summary, and related to that is the reproductive health. Again, we know as presented, Honorable Chair, we know where we stand as a country in terms of our intervention. And I dare emphasize we are doing well. We just have certain areas to improve on. I think I'm still on, sorry, I'm just checking if I didn't skip an article. No, article 15 around sexual orientation, which I spoke to it when I spoke to the issue of sexual stereotyping. And here we can see in Article 15 that further development in terms of national task teams and so forth have been made, and it's work that is ongoing and that will hopefully improve as we learn and implement lessons learned. Equality in marriages and family, I spoke to the legislation around customary marriages and so forth, and it's also repeated here in this article, which continues, Honorable Chair and members, and it is the legislation that we are aware of, and also including our preparations to a unified family code in conformity in the convention. So, and this is what I was saying previously, that we are one country. We have the problems are business for all of us. It's everyone's business. So when you talk to the NDP, and we are responding as a country to the elimination of all forms of discrimination, as per our PEPUDA, which responds to CEDAW as well. And Article 16 continues in that form. In conclusion, Honorable Chair, we will, as the CGE would say, based on this review, it is clear that the country has in many areas made progress and advancements in meeting the obligations of the convention and the policy legislation, tremendous progress. And I think our conclusion, Honorable Chair, without laboring this, basically reiterate what I have already mentioned as I was presenting in terms of how far we've gone as a country and how we need to focus on our weaknesses and improve in that regard. Thank you, Honorable Chair and Honorable Members.
Thank you very much, CEO, and very much, Chairperson, for all the presentations that you have presented to the committee today. I'm sure we are going to do, honorable members, will indicate on the which report are you asking the questions so that the commissioners are able to note the questions and hopefully all your commissioners, CEO and chair, they are going to assist you in responding to the questions that we are going to ask as honorable members. We'll find that in the problem because when I open it, so I will want to start with the last presentation that you just presented as CEO, but the comments that are relating to all three reports that you have presented. So my first question will be, what progress has been made to date insofar as the implementation of recommendations by CEDAW? All the reports that you have presented today. And if you can also tell us, and what exactly do you want the committee to deal, how do you want us as a committee to deal with your recommendations in ensuring that all the recommendations you have made are being implemented by respective departments? And then when CEDAW, how does CGE ensure ongoing monitoring of international obligations such on a annual basis is done? What are the key challenges that hinder domestication of CEDAW and reporting thereof? CGE.
Honorable Chair,
yes.
My apologies to interject. Honorable Chair was cutting. I couldn't get everything on which I was saying.
Oh.
I had the question on. Honorable Chair is cutting. Sorry, I had the question. Sorry, Honorable Chair, we're not. I'm not hearing the Honorable Chair. I don't know if it's only me.
What has been made daily implementation of recommendations account? CEO?
Yes, ma'am. Yeah, Chair was cutting. I wanted to repeat what I had. Should I, as I've missed some things, may I do that?
Yeah.
Thanks, Chair. I had the question on what progress to date on all reports, how the committee can assist in terms of ensuring implementers implement or follow-ups. And then after that, I couldn't get the chair.
Okay. Fresh. My first question, can you hear me?
I can hear you
because
now.
I'm trying to. Okay. My question is apply to all three reports.
Yes.
What progress has been made to date insofar as implementation of recommendations are concerned?
Yes.
Yeah. This is about recommendations that you have made. What is in progress in terms of implementation?
Yes.
How does CGE ensure ongoing monitoring of international obligations such as CEDAW on a quarterly and annual basis?
Okay.
How do you ensure monitor of international obligations CEDAW on quarterly, annual basis? And what are the changes that hinder domestication of CEDAW and reporting thereof?
Okay.
What are the challenges? And has CGE engaged with its Department of Men on outcomes of this report? If not, why? If yes, what were the outcomes? Those were my question on the CEDAW report. Then I want to go to the ERAP. Did you hear that?
I'm trying to follow. Chair, I hear you now, but when you started, I was just waiting to see if I'll get the next part to put it together.
Okay. I'm saying I'm now going to ask questions on ERAP report.
Yes, ma'am.
Did you hear that?
I had the question on the ERAP.
No, I'm going to start. I was saying to you, I'm now going to ask you questions on ERAP report.
Yes.
So that we cannot mix them. Yeah. Remember the first question that I asked on the CEDAW report, I said it applies to all three reports.
Yes, ma'am.
Okay. So my second here is how responsibilities related to women living in rural areas specifically. Did you get that?
Yes, ma'am. Women in rural areas. Chair, Honorable Chair has started with ERAP. Is this in relation to ERAP?
Yes.
Okay, ma'am.
How did ERAP relate to women living in rural areas specifically? And then my next question is, I see in your report, you have noted that there was reluctance by officials from some government departments in providing information to your researchers. Which departments were these? And what were the reasons cited for reluctance of giving information? Did you get that?
Yes, ma'am.
Okay. Number how will they be used going forward? Future and
Honorable Chair has disappeared again.
Studies going forward.
Honorable Chair, can I just quickly clarify that Honorable Chair disappeared for a second? The question is, how will our report recommendations be used going forward?
The findings be used. Yes, okay. Be used going forward.
Yes, I've got it.
Yes. And how will the methodology influence future and studies going forward? Then my last question will be, based on the findings of the ERAP report, how has CGE used this, if at all?
Honorable Chair, may I check if it's my side that is not getting Honorable Chair, or?
It's all of us.
Okay, thank you. Sounds like Honorable Chair is probably disconnected. I'm not sure.
Honorable Chair. Madam
Sorry,
Speaker.
honorable members. Hello. Sorry, honorable members. Chairperson just called me. She's saying that Honorable Masiko must continue because she's got a network problem from her side. Thank you. Honorable Masiko?
Yes, thank you very much, Melissa. Am I audible?
Yes, Honorable Masiko.
Okay, thank you very much. Honorable members, I will also be struggling with sound abuse. I have to board a bus to go to the parliamentary sitting now for the 2 o'clock budget sitting, but let us proceed. I will request for the honorable members that wish to ask questions and make comments on the reports that on the 3 reports that have been presented before us. I will take hands, honorable members. Honorable Sharif and Honorable Ngobo. I'm only seeing 2 hands, and I'm also seeing the hand of the chairperson of CGE. But let us start with the questions and the comments coming from the honorable members. Honorable Sharif.
Thank you very much, Honorable Masiko. Today has been a pretty heavy day with news breaking out with Ricky Rick. May his family find comfort and sending love to them. It did make it a little bit difficult to focus fully on the last report, but I do want to speak about the first two reports that were spoken about. The first one is the top report. You know, I think it's great to point out how progressive we are as South Africa, and I think beyond the CEDAW, we generally have progressive laws and policies that look at bringing equality closer to the reality. However, I mean, even though that this act has been in place for over 20 years, we still find ourselves in situations today where these backyard abortion centers are operating unabated. If you just walk through Johannesburg, if you walk through the CBD, if you walk through, you know, these populated areas, you just are inundated with signage and, you know, messages of illegal abortions. And this is something that South Africa really, really needs to, you know, we really need to look into it and looking at how do we shut them down, because the truth is young women are being turned away from facilities, and young women are having to find alternative ways to terminate their pregnancies. And this becomes a massive issue, even though we have legislation that makes access or should be making access for women easier. It's simply not happening. And I think it would be important for the CGE to perhaps start doing investigations into these backyard abortion facilities and finding out where are the gaps in terms of our law that allows them to operate in these silos unabated. And it's a massive issue when it comes to looking at university students, looking at high school students, and in some instances primary school students that are simply, you know, turned away when needing assistance. And this is something that must be done. I also think it's important for government, Department of Health in provinces to publicize the list of facilities and constantly do that so that people know where to go to get assistance. I know that Mari Stopes has been working in our country for a very long time. Is, you know, when we speak about private facilities, I imagine that this is a public facility, but please correct me if I'm wrong, CEO, and the resources that they get is limited, given the amount of women that need access to TOP. It's very disheartening to see provinces like the Free State only have 12 facilities. Again, it takes away the importance of opening up the space for all types, you know, for women from all across the province and the country to get the assistance that they needed. As well as, I think it's a massive issue when you spoke about the funding models, and that obviously then will go into the lack of resources and capacity that many of these facilities have. In terms of the ERAP report, CEO, you know, we had the Department of Women, Youth and Persons with Disability come to our meeting and basically say to us, the ERAP is done and finished. We need to move on. You need to forget about it. You need to move on, and we're now focusing on the NSP. And I think that the ERAP was for me, and I think when we had that joint sitting, I'm not sure if you remember, Honorable Masiko, when we were in Parliament, we had a joint sitting to discuss the ERAP. And departments simply did not come with enough information to present to us their plans on implementation of the ERAP. And then in that meeting, I had said these targets are, you know, they're impossible to achieve within a 6-month period. And it honestly felt for me, CEO, that this plan, even though it was needed, it felt almost like it was put together and just said, yes, South Africa, look, we have a plan, but that plan is unattainable. And that plan was never going to be attained, especially looking at the specific targets. You can't do that in 6 months. So I think government set themselves up for failure when doing the ERAP. And even though the ERAP has good intentions and good interventions, I mean, I would say that there are some good interventions within the ERAP, there just was not enough time, capacity, coordination, and resources to actually get those implemented and those targets achieved. So now we find ourselves where? We find ourselves, like the chair said, we have a GBVF secretariat that has been appointed and that has been working within the department to facilitate the workings of, you know, GBVF and the facilitation of the GBVF Council once the bill has come back to Parliament and has been approved. Everything seems to be taking so long, and it leaves us in a state of wondering what's actually happening. And in the last meeting, I asked the chair, perhaps we can get yesterday's meeting, we can get the department, the GBVF secretariat through the department to come and report to us and tell us exactly what are they doing, what is their scope of work, and what does their day-to-day you know, work looks like. Because right now, sitting from my perspective, I'm not really sure where everything falls, because everything is still so in the air. So I think that from my side, I think that, you know, we need to look closely at the GBVF secretariat and hold departments accountable for not implementing what they're supposed to be implementing, specifically looking at the National Strategic Plan. I've said this once and I'll say it again. The NSP is a good document, and it's good because it comes from the, you know, brainchild of civic organization in collaboration with government. But implementation has to happen. And I would recommend that the CGE stay on this very closely and monitor key departments, specifically SAPS, Justice, Social Development, and Women, Youth, and Persons with Disabilities, as an example, to ensure that they are doing the work that they're meant to be doing. At the end of the day, having webinars and, you know, doing these talks don't make a difference, don't make as much of a difference in people's lives as actually implementing interventions and strategies that we know can work to make lives safer for women in this country. I'll leave it there, Chair, and if I need to, I'll come back. Thank you.
Thank you very much, Honorable Sharif. Honorable Ngoba.
Thank you, Chairperson, and good afternoon, Honorable Members and Commissioners. I've been covered by the Chairperson and by Honorable Sharif. Chair, I just wanted to find out from CGE if the reports have been shared with all the relevant stakeholders, and in particular the report on termination of pregnancies. I want to find out if they've shared that report with.
Thank you, Honorable Ngobo. Honorable Masondo.
Thank you, Chairperson. Good afternoon, honorable members. Good afternoon, CGE. I just have a few questions here. What progress have been made with the implementation of recommendations contained in this report? The first one. The second one, what challenges has the CGE experienced in the development of the report with the implementation of the recommendations? Number three, has the funding model for TOP services been standardized? If not, why not? Has a functional monitoring and evaluation system been implemented to assess the rendering of TOP services? Thank you, Chairperson.
Thank you very much, Honorable Masondo. I think Chair and CEO, one has been covered by mainly the questions that have been asked by the chairperson relating to CEDAW and the ERAP report. In terms of the choice of termination of pregnancy, I think I must firstly reiterate the words that were said by Honorable Sharif when she mentioned the fact that when walking around the streets of Johannesburg, and the same applies to the KwaZulu-Natal, you know, the big cities, you would find posters everywhere advertising stigmatizing illegal abortions, or what we know as illegal abortions. And we know that given what the report says in relation to noting the fact that approximately 50% of abortions are occurring outside, designated health facilities. And for me, it's a great concern, given the fact that, you are having, the poor and marginalized communities are still struggling with issues of access. So for me, when they find these posters easily accessible in and around, the towns and the cities, they would go to access, such unsafe abortions. That's the first one. The second one, Chairperson, I'm just reminded, I had a dialogue with a number of young women in my province 2 weeks ago. And one young woman actually stood up and spoke about her having 3 kids at the age of 25. And she said that her last child that she has had or given birth to was last year. And she actually said that, in the rural areas, they are lacking access to prevention pills or injections at the local clinic. And they have mainly resorted to drinking, Coca-Cola mixed with Brenta or this thing after every time they engage in sexual activities, because they can't have access or gain access to prevention mechanisms within the clinic. So I think these actually unwanted pregnancies also relate to the unavailability or access to the pills, as well as the injections in our local clinics. And I think it's something that we need to pay closer attention to. The second issue that was also raised by Honorable Sharif that one would like to attend to is the issue of the uniformity in terms of the number of the sites or clinics in the provinces. The first one that I was looking at is the issue that in the Western Cape, the report states that you have 109 sites, whereas in the Free State, you are having 12, in Northwest, you are having 26, Gauteng, you are having 26, in Eastern Cape, which is also one of the biggest provinces, you are having 34 in the Eastern Cape, and you in Northern Cape only have 4. So for me, it's a worrying factor, and it speaks to the issue of the uniformity in terms of the Department of Health at a national level. How is it that you are finding provinces that are bigger or smaller in size having a larger number, and then you are having those that are bigger having a lesser number of the clinics or the sites where one can perform the termination of pregnancy? And it also speaks to the issue of the uniformity of the standard operating procedures for the Department of Health. Because here we are referring to one department, regardless of the fact that it's got different sites in different provinces, but it's one department. How is it that one province is not standardized? What is done in one province is not necessarily what relating to what is done in another province. And it also, the same issue of uniformity speaks to the issue of the referral system as well as the funding model. And I think it's something here that one would propose that we have a serious meeting with the Department of Health to address these issues and address issues of uniformity and accessibility, especially to women in rural areas and women who are coming from the poorer backgrounds. It's important for us to ensure that we are saving lives, because the unavailability and inaccessibility of a free choice to terminate the pregnancy will result in women resorting to the backyard illegal abortions, which places a danger to their lives. The last one, Chairperson, one would like to address is the issue of limitations. You have noted in the report that you were only dealing with the desktop study because you couldn't visit the site. But we know that for a long time now, there has been an easing of lockdown regulations. Movement has been allowed. We could way to see these issues that are raised on paper. And you find most of the time that some of the issues that some of the reports that we are getting are not exactly true on paper when you are actually there physically. So for me, it's important for us to also embark on a process that would also go to the physical side to check on what the processes are. I'm covered on the issue of the case management or complaints management. It's quite important for us to look at that, as well as the public education. I think it's very important, Chairperson, for us to look closely at the public education on the termination of pregnancies, because it what also leads to young people drinking, Coca-Cola and Disprin, so that they don't fall pregnant. In the case that the Coca-Cola and the Disprin doesn't work because they don't have access to the injection and the pills. In the case that it doesn't work and they fall pregnant, they will then resort to the backyard, the backstreet abortion or illegal abortion, simply because they don't have access to the site that they should or they ought to be performing the abortion. And I also think that the last one would be with regard to the regulatory body in terms of the medical, medical officers who don't want to perform these abortions because of their own beliefs or maybe cultural beliefs as well as the religious beliefs. Is there any way that, or are there any, medical officers that have been held to account for their refusal to perform such abortion? Thank you very much, Chair. I will hand over to the Chairperson as well as the CEO and the commissioners to respond. Oh, the Chairperson is back. Okay, thank you, Chair. I'll hand over back to you. Thank you.
Thank you very much, Honorable Masiko. I think I heard you with regards to the last 4 issues that you have raised, which is non-accessibility of non-availability of facility, especially in certain provinces, like, for example, in Northern Cape, and the issue of a funding model, and I think there were 4 things that you spoke about. I'm sure I've missed 2 of them, but you can remind me which, as the portfolio committee, will have to make a recommendation to the portfolio committee on health standardization. Standardization of services in all the provinces. I think these are critical issues that we need to raise with them, and we need to have a meeting with the portfolio meeting with the Department of Health and portfolio committee on health to address the findings that were presented in the report by CGE. But also, I think lastly, I want to say to ECGE what assistance do they need from us as the portfolio committee in ensuring that their recommendations are being implemented. If they can just say it, so that we can also put that in our recommendations. But we know as the portfolio committee what needs to be done, but we also want to hear from them what do they need, what type of assistance they need from our side. Thank you very much, honorable members. It was just unfortunate that some of you, I did not hear your questions, and but at least I will get from Hansard and other issues that you have raised, but it's okay. Thank you very much, Masiko, Honorable Masiko, for continuing with the meeting. Over to you, Chairperson and CEO.
Shall I go, Chair?
Thank you, Chair.
Oh.
Am I audible, Chair?
Yes, I can hear you.
Thank you very much, Chairperson, and thank you to honorable members for the questions and comments shared. Chair, I think because we really struggled to get all your questions properly, I would humbly ask Chairperson if the questions could be sent us again in writing so that we can be able to respond comprehensively to the questions you asked, Chair, because you were cutting. Chair, I want to start on something that you made reference to in terms of CGE engaging with Department of Women, Youth and Persons with Disabilities in so far as engaging with the newly established GBV Council. Chair, if you go to our ERAP report on page 24, there is a reference that is made in that page that CGE is more than willing to engage with the newly established structure, which is the GBV Council, due to the agency to address gender-based violence and really monitor all the departments and entities in terms of the work that has been done and achieved to date. And I also want to say that, Chair, we will also really be waiting on the processes of the bill and a fully establishment of the National Council on GBV. And what we will do, Chair, is to first share the report with the established Council on Gender-Based Violence, but also what we will be doing is to also look at the necessary mechanisms or enabling legislations together with the Council and the Department of Women based on the information received to really look at how these bills and these legislations are able to provide an enabling environment to address gender-based violence and femicide in South Africa. And this will not only be limited to the Council, Chair, we will also be looking at other structures such as the South African National AIDS Council. We will be looking at the Department of Justice and Constitutional Development, the NPA, the South African Police Services, and the Department of Education, Basic and Higher Education, just to mention the few, Chair. And these, if I can just single out one, Chair, the work that we are currently doing, a follow-up work that we are currently doing with SAPS, Chair, one of the key questions that we ask in our tool is basically to look at whether within SAPS, the law enforcement is done, but besides that, we are also looking at the enforcement of current legislations. For an example, on alcohol, including withdrawal of licenses from these alcohol outlets if they don't comply. So these are some of the things that we are following up based on the ERAP report and the 5 key thematic areas, Chair. But also, we are also looking at Department of Justice and Constitutional Development, NPA, in terms of granting of bails, imposing sentences, legislations, and looking at the national registers for sex offenders. So these are kinds of the work that when we do our monitoring and follow up on the ERAP report, Chair, we actually do that and we ask those critical questions. Chair, let me go back to the question that you imposed or you asked earlier and that you are asking now. What can the committee do to assist in ensuring that the recommendations made are implemented? Chair, very quickly, what we would really request the committee to do and assist us based on these 3 reports is to look at each report. For an example, the CTOP, Chair, this is where we would request and recommend that the committee assist us in terms of engaging the committee that is responsible for National Department of Health or Health. It can also be just a joint meeting, Chair, we would be willing to come back and make a presentation. And based on presentations, the committees can look at how we can monitor and make sure that the recommendations thereof are carried forward. I think the same goes to the ERAP. Chair, there were 22 government departments, and there were entities outside those 22 government departments, such as the political parties, the civil society organizations. Chair, this is where we will really request and sit down with the committee and look at those 22 government departments that were given the responsibility to implement, the 39 areas based on the 80 targets, to really look at what were the bottlenecks, what were the tube feeds, or what were the challenges here, Chair. And I know that based on Honorable Sharif, which I fully agree that the time was a bit of a constraint, the resources were constraints in terms of fully realizing the implementation of the ERAP. But I think, Chair, what we can do is to really request that with all these 3 reports, CEDAW report included, Chair, we can look at how the portfolio committee can assist us to have a joint meeting with the departments responsible for implementation of these 3 reports. I think that's the first one, Chair. The second one, Chair, I think perhaps the request, cognizant of the time, would be to really request that the questions asked by the chairperson be sent to us in writing so that we can respond in writing. In terms of other questions, Chair, can I pause here? But I really fully agree that with the termination of pregnancy, the advertisement of the clandestine abortion or the backstreet abortion is something that needs to be looked at. And honorable members are quite correct to say, if you walk the streets of Johannesburg and Durban and other big cities, you will find that this is clearly advertised, and people would, even in terms of access, would opt going for clandestine abortions, Chair, with a lot of complications that would come out of that intervention, Chair, because you will find that people will come back with uteruses that have been perforated. They would come back with a sepsis, and they would still be referred to healthcare facilities for care of those complications or things that went wrong during the backstreet abortions, Chair. And this is one area that we need to really engage the department in terms of making sure that there are expansion of the facilities in provinces where there are very less. We look at issues of access, and some of these can be taken closer to where people live or very hard to reach communities. In particular, what I have in mind is how do we make sure that women living in rural areas are easily, accessed with these kinds of facilities, Chairperson, in the nearest clinics where they are. So this is kind of information that we would look at. But also, Chair, what was also raised was how do we look at the regulatory bodies in terms of making sure that the information or those that do not want to perform abortions or termination of pregnancy in the facilities, how do we deal with that? I think beyond Department of Health, Chair, the regulatory bodies that are there is the South African Nursing Council, which is SANC in short, the DINOSA, as well as the HPCA, Chair. These are the bodies that need to be engaged, Chair, so that these regulatory bodies can actually be informed of a possible refusal of some of the healthcare providers to provide the services based on their religious beliefs or based on their cultural beliefs. So I think that's that, Chair, and I think this will also be something that needs to be coupled with some kind of training and monitoring of the training thereof in terms of rollout. I will pause here, Chair, and I will allow a CEO to come in and my fellow commissioners to come in with the responses, Chair.
Honorable Chair.
CEO, you can continue.
Thank you.
I saw the Deputy Chair also here. You can continue, CEO.
Oh, sorry. Thank you, Honorable Chair. Chair has responded to many of the questions asked, so I'm picking those where I can still respond. Firstly, the Honorable Chair's question in terms of what progress to date relating to the 3 reports that have been presented. If I can start with the CEDAW reports, in terms of regional and international instruments, generally, we report periodically as a country, and when the country is reporting, we also monitor from the perspective of the Commission. So as we are busy with plans for 2022-2023, the conversation we're having with researchers is what is up for country reporting in 2022-23, and then they're working on that and the plans for that, and the research instruments, so that we begin the compilation of information and report. So in a sense, in our quarterly annual reports, unless there are specific issues that relates to the conventions that we need to monitor and report on, we would not necessarily have quarterly targets because we report periodically. So the next reporting period for CEDAW will be informed by the overall country reporting and other activities. Perhaps just to add quickly there that, as indicated by pretty much all the in research and investigations that we've presented so far, one can see, as I was skipping in the CEDAW report, that we've already done work that shows how we're responding as a country. So whatever the next reporting instruments, this will form part of our cross-referencing in terms of monitoring when we get to that. In terms of the termination of pregnancy report, this was a report that was produced in the current year at the end of the previous year, March 2021, let me put it that way. So, and then as I was presenting, I kept picking up questions that we asked and not get information, and then the recommendations or as a matter of practice goes to those targets in our APP, where we say we will follow up on recommendations on the previous year or whatever other information that we feel as the CGE is important for follow-up, and that would include your issues of ERAP, in a sense that we are, as I indicated, we are in the CGE internally, we're trying to not speak the narrative of ERAP, because obviously we are met with that ERAP no longer exists. But we know gender-based violence exists. We know the National Strategic Plan is addressing the same issues, and all other structures and instruments that seek to address gender-based violence. So our projects or programs are still monitoring those. So the issue of gender-based violence, gender-responsive budgeting, teenage pregnancies, access to termination of pregnancies, those recommendations form part of the project going forward in terms of follow-up those recommendations. So to date, when we report for 2021-22, we will have an updated report that talks to what is the progress around the implementation of the NSP related activities? What is the progress related to the implementation of gender-based violence programs? And we're talking about national programs. What is the progress in relation to all these aspects that we have made recommendations on. So our next report will speak to that. At the end of 22-23, we will have a full report that have conclusions based on the information that we would have at that time. So that is in relation to progress to date. So those are ongoing work as we do this. The challenges regarding the ratification of international instruments. Honorable Chair, the report, when I read it, I wouldn't come with a comment based on this specific monitoring. But if Honorable Chair were to ask me generally from other research readings and all that work, I would my comment would be, as a country, I don't think we have much of a challenge when it comes to ratification. Of course, we do object to certain things here and there, but mainly we have ratified, especially instruments that seek to address issues of gender equality. So in that sense, I would respond in that way. The next point that I wanted to the issue of ERAP and how it addressed issues of women in rural areas. And I just wanted to indicate that when we monitored the implementation of ERAP, findings were put forward that we don't reach people equally. And I think this would apply even in questions relating to the CTOP Act report, that those differentiated focus in terms of addressing the issues. And I'm sorry I keep using the language, it still reflect the picture of the apartheid era, meaning those who were previously disadvantaged. Generally, you would find that they are still disadvantaged. And whether you're speaking to issues of access, availability, resources, and I think I was presenting to a different committee on a different study when I said, if you look at major cities that generally Black people didn't live in the past, they tend to come across as more resourced than your cities or places in Mpumalanga, Eastern Cape. And for me, these are some of the areas of focus to address inequality. And it applies to all our reports. I think I did mention that you see that in all our reports. And it also relates to the issue of fund allocation. Chair, I'm trying to lump in a few comments just to say it's pretty much the same issues. The equitable share approach that is used, how much is going to Johannesburg versus how much is going to Mpumalanga, what is that based on? That's why I was talking about evidence-based resource allocation. We know how many people are here, how many people here use this service, if so, what is required? So all those questions in terms of access. The issue of the willingness of providers and the regulations. This, I mean, I had made a comment that we are implementing the Constitution. This is about the basic human rights. But at the same time, in our Constitution, we also have the right as people to our cultural practices and what have you. So you have, and this is an opinion that comes in different studies, and you try to figure out how do we balance this, and laws get challenged when people feel that they are let's say their religious beliefs, for instance, they believe are being eroded by the Constitution. So this is, for me, it's a quagmire that we must still address as a nation. It relates to the adverts on the streets. Chair spoke to that, but it relates in a sense that there are complex factors that lead certain people to prefer those services than go in a public service. So it's some of those nuanced challenges that for me, and these are the areas I kept saying we need to focus, do more research, and try to penetrate these hidden areas of the problems, the challenges that we are highlighting. I'm skipping the issue of turning away clients. We talked to that, and I think Honorable Sharif somewhere comments that were just expressing the worries around the presentations that we were making, following up with key departments. I think I've responded to the issue of funding, the equitable allocations, the differentiated numbers of facilities in different provinces. Honorable Chair, I don't know if I've killed two birds with one stone in trying to lump these questions and comments together in my response, because they speak pretty much to the same root causes. Hence, I have tried to summarize them like that. Thank you, Honorable Chair.
Thank you very much, CEO. If there's any commissioner who wants to add. There's no additions, then it means all commissioners are covered. Thank you very much, CEO, for the response. We'll forward all the questions that you did not hear formally to you so that you can be able to respond in writing. But your request is accepted. When we convene those portfolio committees, will then also invite you, so that some of the issues that you have raised in your reports, we will have to make follow-ups with those departments on what is it that they have done. But what I will advise you to do, CEO, is that if you did not share your report with those departments, may you please share that report with them, so that when we invite them to a meeting, at least they do know and they would have read the report.
Noted with thanks, Chair.
Yeah. But thank you very much, CEO and Chairperson. At least we've dealt with all the reports, and as the committee will make reasonable recommendations, and will ensure that recommendations that are to be implemented by departments, they are implemented. I'm not sure whether we are near CEO or Mina Angzora.
Yeah, Madam Chair.
So.
No, you were clear.
Oh, okay. Yeah, but thank you very much for your time. And Chairperson, thank you very much for ensuring that you honor this meeting of today. And I think we're done with all the reports that were outstanding. Some of them were in Parliament even before we were appointed as members of this portfolio committee, but were able to deal with them in the previous weeks. So we'll have a way forward. We'll see in our next term if we don't, if there's space so that we can be able to have joint portfolio committee meetings and invite those departments to come and account on the recommendations to be implemented by them. I think we're done, CEO, with CGE.
Thank you.
CEO, we're done. Chairperson, we're done with CGE. I'm not sure
Thank
if.
you. Bye.
Bye.
Oh, bye, Chairperson. I thought we were still going to. We thank all of you, Chair, honorable members, and Chairperson, that you've given us opportunity to share our reports with you. Thank you, Chair, and goodbye. Goodbye, everyone. Goodbye.
Nelson, I think you will need to adjourn the meeting so that honorable members can break for lunch and prepare to join the budget sitting that is starting at 2.
Yes, Chair.
Okay, the meeting is adjourned.